Thank you. Ladies and gentlemen, sure to please take your seats. Ladies and gentlemen, please take your seats. Ladies and gentlemen, esteemed dignitaries and honorable guests, it gives me immense pleasure to welcome you all to the launch event of the World Economic Forum Center for the Fourth Industrial Revolution Telangana, world's first thematic center focused on healthcare and life sciences. Today marks a significant milestone as we gather here to embark on journey towards fostering innovation, collaboration, and transformation in the realms of technology, healthcare, and beyond. We are honored to be joined by our esteemed dignitaries whose leadership and vision have been instrumental in bringing us this pivotal moment. I would request you all to give a huge round of applause as we welcome and acknowledge the presence of D. Sridhar Babu Garu, Honorable Minister for Industry and IT, Government of Telangana. And now I take this opportunity and welcome the global CEOs on stage. Ladies and gentlemen, let us please welcome Mr. Dave Ricks, Chair and CEO, Eli Lilly. Dave Ricks is Chair and Chief Executive Officer of Eli Lilly and Company, a Lilly veteran for more than 25 years with experience in marketing, sales, drug development, and international operations. We welcome you, sir. With a huge round of applause, let us welcome on stage Mr. Jeff Martha, Chairman and CEO, Medtronics. Oh, wow. Jeff Martha is Chairman CEO of Medtronics, the global leader in healthcare technology. Jeff leads Medtronic in pursuit of fulfilling the mission to use technology to improve human welfare. And now, ladies and gentlemen, I take this opportunity to call on stage Mr. Jeremy Jurgens, Managing Director and Head of Forum's Center for the Fourth Industrial Revolution, with a huge round of applause. Let us welcome on stage Mr. Jayesh Ranjan, IAS Special Chief Secretary of the Industries and Commerce and Information Technology. Now, let us welcome and extend a warm welcome to the founding members of WEF C4IR Telangana Center. Ladies and gentlemen, please put your hands together for Ms. Uma Devi Chigurupati, the Executive Director of Granules India. Mr. Krishna Reddy, Chief Operating Officer, Andhra Pradesh and Telangana Cluster, Roche Pharma India. Mr. Fani Mitra, B Global CIO and CTO, Dr. Reddy's Laboratories. Dr. Rajaram Iyer, Executive Vice President, Loris Labs. Let the claps keep rolling, ladies and gentlemen. I would also take this opportunity and welcome on stage Mr. Shakti Nagappan, Director, Life Sciences and Pharma, Government of Telangana. So I request you to please give your introductory address.
Very good morning. Honorable Minister for Industries, Shri Sridhar Babu Garu, dignitaries on and off the dais. Firstly, apologies for starting very late. We've compressed the program to be able to close on time. Thank you for your understanding. This is indeed a momentous occasion for Telangana and in fact India. In lieu of launch of this World Economic Forum Center, which would be the first in the world for focused on life sciences and healthcare, being set up in partnership with World Economic Forum. So I would request all of you to be part of this whole journey that Telangana has started. So I will keep it quick and tell you what the center is going to do. The center has focus on 3 different areas. Real world evidence, a market which is growing at 20% year on year, and focused on bringing evidence-based care to market faster. Healthcare analytics and informatics to ensure data-driven decisions in delivering healthcare, and software as medical device. So within these 3 focus areas, we have rolled out a number of initiatives, which starts with the establishment of a clinical registry at the state level, focused on hemophilia and other rare diseases. So we are piloting this in 3 different hospitals. So this will be a start, and we will roll this out across the state. We are setting up a clinical innovation sandbox to promote startups and innovation to get their products and prototypes tested in the clinics. We are also opening a data and analytics lab to propel innovation on clinical and wearable devices. We will also be rolling out a high-throughput skilling program to develop industry-ready talent in the state at an unprecedented scale. Honorable Minister will be talking about some of the initiatives that we are rolling out, particularly the skilling program. I'm confident that the initiatives taken under C4IR Telangana will really have a profound impact on the healthcare, not just in India, but also across the world. I invite you once again to be a part of this journey, and good morning and welcome once again.
Thank you very much, Mr. Shakti. And now, ladies and gentlemen, the moment which we all were eagerly waiting for. The logo launch of C4IR Telangana. And to do the honors and to unveil the logo, I would request our Honorable Minister for Industry and IT, Government of Telangana, D. Sridhar Babu Garu, to please do the honors, along with Mr. Dave Ricks and Mr. Geoff Martha. Please step forward for the logo launch of the C4IR Telangana. Ladies and gentlemen, this day would have not been possible without the support of the World Economic Forum. On that note, I would also like to request Mr. Jeremy Jurgens, Managing Director and Head of the Forum's Center for the 4th Industrial Revolution, to please step forward for the logo launch. I would also humbly request Mr. Jayesh Ranjan and Mr. Shakti Nagappan to do the honors along with the other dignitaries. Ladies and gentlemen, we all are gathered over here for this auspicious day for the logo launch of the C4IR Telangana. Ladies and gentlemen, let the claps keep rolling. Thank you to the dignitaries. Ladies and gentlemen, the official logo launch is here. Once again, on that note, can we make some noise with the logo launch? The logo is here of the C4IR Telangana. Thank you very much to all the dignitaries to do the honors. Now to share his thoughts on the WEF C4IR Telangana and what he feels about the center, I humbly request Mr. Jayesh Ranjan, IAS Special Chief Secretary of the Industry and Commerce and Information Technology, to please join me at the podium.
Thank you very much. Honorable Minister for Industries and Information Technology, Government of Telangana, Shri D. Sridhar Babu Garu, distinguished global industry leaders, Dave Ricks, Jeff Martha, Jeremy Jurgens from the World Economic Forum, distinguished industry leaders from Telangana and Hyderabad, my colleague Shakti, invitees, guests. It is indeed a very landmark day for all of us. The discussions with World Economic Forum to establish their Center for Fourth Industrial Revolution focused on healthcare and life sciences was in progress for almost 5 years or so. In fact, we had first mooted this idea before COVID, and I'm very proud that it is materializing, it is fructifying today with this formal launch ceremony. Many of you would know that there are similar other centers which focus on healthcare established by the World Economic Forum in other parts of the world. And our endeavor would be to identify certain challenges, certain problems on which all of us can work together, certain problems on which a few of us will work together, and some problems which are very unique and distinct for our country, India, which will be the focus of this center in Hyderabad. We are very grateful to all the industry leaders from Hyderabad who have decided to support this center, because many of you would be familiar, every activity of the World Economic Forum mandates that it is not just the government alone, but the entire range of stakeholders should join hands and collaborate and support. So happy that the industry has come forward, and all the industry leaders who are sitting on the dais. I'm very grateful to all of you on behalf of the Telangana government. I'm happy that there are a large number of educational institutions, principals, students who are part of the audience today, because as my colleague Shakti pointed out, skill development, capacity building will be one of the most important endeavors of this center. And because we are located in Hyderabad, which presents a very fascinating confluence of technology and life sciences, we would be helping in sharpen the skills and capabilities and competencies in both these domains. So lots of colleges of pharmacy are represented here. It should not come as any surprise to you that at some point in time, your students will also be encouraged to take up courses in technology. And similarly, in colleges where only engineering is taught, again, it should not come as a surprise if courses related to life sciences or chemistry or biology are offered as minors, so that many of you get equipped to handle the future challenges and responsibilities coming up in this sector. So once again, I'm very proud and happy that we are witnessing this day when the World Economic Forum's Telangana Center for Fourth Industrial Revolution focused on life sciences is getting launched. From time to time, we'll be publishing updates on what we are achieving, what we are striving to do. We look forward to your continued collaboration, support, and suggestions. Thank you very much.
Thank you very much, sir, for your insight. Now I would request Mr. Jeremy Jurgens, Managing Director and Head of World Economic Forum, to please step forward to speak a few words.
Great. So, Honorable Minister, distinguished guests, ladies and gentlemen, pleasure to be with everyone here today for the BIOASIA 2024. As we gather at this forum, I think we're reminded of the critical juncture we're at in society. This rapid advance of technology, of AI that we read about, the uncertainty that brings, and yet the importance of addressing very fundamental areas such as health, education, and well-being for all the citizens in the economy. We can only balance these tensions or address them through a combination of innovation and direct kind of conscious efforts to harness the technology for the benefit. And this is one of the reasons that we've decided to establish our Center for the Fourth Industrial Revolution on Life Sciences here in Telangana. We couldn't find a better place that we could actually look at the combination of bringing the life sciences sectors together. We see the investments that a number of both national and multinational CEOs are bringing to the community here, building on the strong skills and the base of knowledge to do that. And we think that through this combination of effort, we can harness the artificial intelligence, genomics, telemedicine, medical devices, all for the benefit to improve the resilience and quality of our healthcare services. And by doing this together, we can be a benchmark here not only within Telangana, within India, but globally. And for this reason, this will be the first center that the Forum does establish around the life sciences, joining a global network of other centers that are focused on topics ranging from energy, manufacturing, and artificial intelligence to other areas. But again, this is the only one that will focus here on the life sciences. Now, according to the World Health Organization, in 2020, we spent $9 trillion on healthcare in US dollars. That was the equivalent to 11% of GDP. And yet at the same time, estimated that about $2 trillion of this made minimal or no contribution to actually benefit the inpatients or in the system there. And so we have quite a bit of inefficiency here. Similarly, it was seen that there's collected over 2.3 zettabytes of data. Now, I don't know about the rest of you, I don't know what a zettabyte is or how to measure that. That's 2 trillion DVDs. And even again, in 2 trillion DVDs, I wouldn't know what to do with 2 trillion DVDs. Among that data, 97% of it went underutilized, right? So we're collecting all this data, all this information, but it's unutilized. Now today, with new tools on artificial intelligence and data, we start to be able to see the ability to sift through all that data and bring forward opportunities from it so that it doesn't just go unused in a computer in the cloud somewhere, but that we actually start to unlock that. And in line with the theme of data and AI, we can actually use that for the benefit here. Now, alongside this, with advancements in other areas in frontier technologies, this presents unparalleled opportunities. In leveraging these resources, we can more effectively manage chronic diseases, improve treatments, and substantially reduce healthcare costs and achieve sustainable outcomes. Now, at the World Economic Forum, we're deeply committed to fostering collaborations that use public and private sector collaboration to bridge the gap and tackle these pressing challenges. Healthcare is at the forefront of this agenda, and we believe that innovation, equity, and sustainability are not only goals, but necessities for a better future. And in this regard, today marks a significant milestone in our collective journey towards an ambitious future with the launch of our Center on the Fourth Industrial Revolution here in Telangana, focused on the life sciences. We look forward to working with all the companies here in the room and in the larger community to continue to advance against these objectives and improve the quality of lives and the opportunities for everybody here. One last area just to highlight on selecting Telangana, and this is this aspect of collaboration. And I think it's represented by the partnership that we've had with all of you to continue this kind of collective approach to addressing these challenges together. So with that, I thank you for joining us in this journey, and I look forward to the continuation of the discussions here. Thank you.
Thank you, Mr. Jeremy. Now, ladies and gentlemen, at the core of the center, we have formed partnerships with the best-in-class organizations to catalyze our vision. We'd like to take this opportunity to announce the valued partnership with National University of Singapore, Garment Health, Calix, and Digital Medicine Society. We'd like to use this prestigious stage and this occasion to formalize these partnerships, and to do so, I would like to please call on stage our Minister D. Sridhar Babu Garu. Sir, can you please step forward to do the honors? With a huge round of applause, let us acknowledge this partnership. Jay Shanjan, sir, please, can you also join him? The representatives of Telangana Life Sciences. And ladies and gentlemen, on that note, I would like to first call on stage Mr. Scott Burgett, Senior Director of Garment Health Engineering, and his team from Garment Health to please come up on stage as we celebrate the partnership with Garment Health. Ladies and gentlemen, this is a moment for all of us to rejoice. A huge round of applause. Thank you very much. And now, ladies and gentlemen, I would like to request Mr. Johann Sebastian Sapnel, Head of Health Innovation from the National University of Singapore, and his team from NUS to please come up on stage. And this is for the exchange of MOU. Ladies and gentlemen, yet again, a moment to rejoice. A huge round of applause. Thank you very much, gentlemen. Now I would like to take this opportunity and call on stage Mr. Madhav Vettikutti, Senior Vice President of Technology, General Manager, India, and this is for the MOU exchange with Calix. Ladies and gentlemen, a huge round of applause. Well, the Time leadership could not make it to the launch today, but we still would like to acknowledge and celebrate them as our valued MOU partners. So a huge round of applause, let the claps reach them, the team Time. Thank you, gentlemen, to do the honors. At the core of the center, we have our founding members who believed in the vision of the center in improving the healthcare access for the state and Core IR Telangana a success today. Taking this thought forward, I would like to please request Ms. Uma Devi, the Executive Director, Granules India, to please join me here at podium and share her thoughts.
Namaste. Distinguished dignitaries on the dais, esteemed guests, ladies and gentlemen. Today marks a truly historic moment for Telangana and the vibrant city of Hyderabad as we witness the inauguration of World Economic Forum Center for the Fourth Industrial Revolution C4IR Telangana, a groundbreaking collaboration between Telangana government and World Economic Forum. As one of the founding members of this esteemed initiative, representing the life science industry, we take pride in our role as an anchor partner. This partnership symbolizes a remarkable opportunity to harness the power of technology for the advancement of healthcare and life sciences, not only within our state and nation, but on a global scale. Among the early initiatives planned, the creation of a state-level clinical registry is particularly promising to facilitate access to treatment and research across various high-burden disease areas. At Granules, we eagerly anticipate leveraging the extensive network of clinical sites provided by C4IR Telangana to drive forward our clinical research efforts. I am especially pleased to learn about C4IR Telangana's commitment to nurturing a highly skilled workforce, which will undoubtedly propel our industry forward and foster scalable growth. The skilling initiatives, with their focus on specialized courses, job opportunities, mentorship, and exposure to real-world challenges, present an invaluable opportunity for talent development. I urge C4IR Telangana to place special emphasis on skill development for women. By prioritizing skill development programs tailored to the needs and aspirations of women, we can break down barriers and create pathways for their meaningful engagement in various roles within the healthcare ecosystem. When women are equipped with the necessary skills and knowledge, they become agents of change, driving positive health outcomes and social progress. Additionally, prioritizing sustainability in healthcare innovation is paramount in addressing the urgent challenge of climate change. The healthcare sector has a significant environmental footprints. As stewards of public health, it is our responsibility to adopt environmentally sustainable practices that minimize harm to the planet while maximizing the health and well-being of current and future generations. In conclusion, today's collaborations and partnerships represent just the beginning of a transformative journey. Together, we have laid the foundation for a dynamic ecosystem that will drive innovation and enhance healthcare outcomes for all. I have full confidence that C4IR Telangana will continue to flourish, making a tangible difference in people's lives. I eagerly anticipate our continued involvement in this remarkable journey of progress and impact. I wish the C4IR Telangana all the very best. Thank you.
Thank you very much, ma'am. Now representing Roche, I request Dr. Monica Puri, Chief Country Access and Policy Officer, to please join me on stage.
Good morning, Honorable Minister D. Sridhar Babu sir, respected Principal Secretary Jayesh Ranjan sir, distinguished guests, CEOs, industry colleagues, ladies and gentlemen. 128 years counting and still going strong. I'm standing here and representing one of the world's largest biotech company and global pioneer in healthcare innovations, Roche, focusing on advancing science to improve lives through our exhaustive research pipeline. And since last 60 years, we have enabled in India, through our dedicated workforce, tirelessly to realize the vision of doing now what patients need next. We believe that healthcare access challenges can be best addressed through multi-stakeholder collaborations and partnerships. And COVID is a great example where we learned not just across India, but across the world, these partnerships between academia, government, regulatory bodies, industry bodies, multilateral organizations, they came together and solved for this crisis. And that is why we need to set great examples of partnership across the world. And now, talking about India, the partnership with Center for Industrial Revolution is a great move towards realizing our goal of what the world needs next. Through our collaboration, we aim to build a scientific data-based decision-making in solving for bigger healthcare challenges. To start with, we will focus on building a state level, as ma'am has also mentioned, a clinical registry to understand the unmet need of healthcare challenges, and starting with one of the debilitating bleeding disorder called hemophilia, we are very proud to partner with the C4IR to make sure we understand the challenges and look at the opportunities to solve for a sustainable solution. Not only this, we aim to leverage the power of technology along with clinical innovations to create significant impact on the lives of the patient. And therefore, we would also like to collaborate on upgrading the clinical trial and research capabilities in the state and bring many more global clinical trials to India through our partnership and through our learnings with C4IR. This has been our ongoing initiative across government facilities, and through C4IR, we'll be able to expand it to a broader range of hospitals and look at the clinical data coming our way. We are committed to play our part and collaborate further for a better, more dynamic and responsive healthcare ecosystem. And to sum up, we require new age technologies and data-driven decision-making to disrupt the healthcare delivery models, and therefore to ensure that adequate infrastructure is ready for future preparedness without compromising on the services for prevention, diagnosis, treatment of patients. Therefore, together, we can improve access to healthcare for most underserved patients and population with a special focus on the role of innovation that brings in. And C4IR is well poised to be that change agent for India in this regard. I wish success and congratulate the entire leadership of C4IR, WEF, and the government of Telangana to bring this opportunity to the heart of India in Telangana. Thank you very much.
Thank you very much, Dr. Monica. Now I would like to please call upon Mr. Fani Mitra B, Global CIO and CDO, Dr. Reddy's Laboratories, to please join me.
Honorable Minister, distinguished guests and colleagues, good morning. As a company that is founded 40 years ago in this vibrant city of Hyderabad, I feel very proud that we're actually having World Economic Forum and the C4IR come to our own city here. So congratulations to everybody involved in this process. We have been working very closely with the World Economic Forum as we certified our digital lighthouse, one of our manufacturing plants here in Hyderabad, a couple of years ago. And it has been an enriching experience. It was both a great learning opportunity as well as an opportunity to build our capabilities in our own organization. So the fact that we are having the center come here to the city and to the state of Telangana is a great step forward, and I think we'll all remember this day, with fond memories as we look forward into the future. That this was the day when some of these foundations were laid, and I particularly am pretty excited. As a person who is very fond of analytics at my heart, I love the idea of bringing technology and data together, as well as the ideas to create clinical registry and so on. So the ability to bring government, industry, and more importantly, the academic partnerships, into skill development. I think the three core pillars that are important for the success of this initiative are all in place. I look forward with great excitement into what this will evolve into. And I wish all the very best for the team and to every one of us. Thank you.
Thank you very much, sir. I would humbly call Dr. Rajaram Iyer, Executive Vice President, Loris Lab to please join me here. Over to you, sir.
Thank you. Good morning, Honorable Minister, distinguished dignitaries on the stage, ladies and gentlemen. It's an honor to be associated with C4IR, which is a new initiative, not just for the state of Telangana, BioAsia. I think it's a national asset which will create a lot more opportunities for us to change the orbit of what we do. Yesterday we discussed a lot about volume to value transition and how the industry is evolving and moving, and I think initiatives like this will really are pivot points for us to change our orbit and move into a very different dimension of providing innovative, affordable solutions to globe, I would say. So we are very happy and proud to be a founding member for this C4IR initiative. We at Loris wish this initiative all the success, and thank you for letting us be the founding member. Thank you.
Thank you very much, sir. Now, to mark their significant contribution, I would request Shri D. Sridhar Babu Garu, the Honorable Minister for Industries and IT, to kindly present our founding members with the mementos as a token of appreciation. First, I would humbly request Ms. Uma Devi, Executive Director, Granules India. Ladies and gentlemen, let us give a huge round of applause. All the founding members, Mr. Krishna Reddy, Chief Operating Officer, Andhra Pradesh and Telangana Cluster, Roche Pharma, Mr. Fani Mitra, P Global CIO and CTO, Dr. Reddy's Laboratories, and Dr. Rajaram Iyer, Executive Vice President, Loris Labs. All the founding members, I humbly request you to step forward. Ladies and gentlemen, let us give them a huge round of applause. Thank you very much. And now I humbly request Sri D. Sridhar Babu Garu, Honorable Minister, to please step forward and say a few words. Let us welcome him with a huge round of applause, ladies and gentlemen.
Very good morning to all again this day. Ladies and gentlemen, industrial leaders, my team from state of Telangana, and the leaders from industry on the days, of the days, and our partners of many educational institutions who are here, and the friends from media. As everybody has said, first of all, we extend our thanks to WEF, World Economic Forum, which has set a significant milestone as we gather to inaugurate the Center for Fourth Industrial Revolution, that too in Telangana. One of the members was speaking about the pride. It's not only a pride of Telangana, it's also a pride for our nation, India. We appreciate it. We take this pride, basically the hard work, all the industry leaders, all the researchers, all the scientists, and the government for the past 4 decades have played a key role in making Hyderabad, Telangana a prominent place for the life sciences. That may have the reason, and that is the reason that WEF has considered Telangana as its mark point. As the Minister for IT and Industry, and on behalf of Telangana, I sincerely extend our warm greetings to all of you who have joined us here, who have contributed their might, their pride, their energy to make this happen. I thank you once again. Our journey for Center for Industrial Revolution Telangana has been one of collaboration, innovation, and of a shared vision. Today, it makes me feel proud to witness this event and welcome all our guests and dignitaries who have joined us from different parts of the world. The launch of this center opens the door to immense possibilities of the future. We have leveraged the inherent strength of Telangana and its unmatched ecosystem of life sciences companies, making Hyderabad the most ideal location of the center. Telangana contributes about 40% of India's pharma's production. The state is not only a hub for manufacturing, producing more than 1/3 of the global vaccine supply, nearly 14 billion doses annually, but it is also home for 1,000+ global healthcare and life sciences company. We are proud of it, sir. Hyderabad also hosts the largest development centers outside of their respective headquarters for technology giants like Amazon, Google, Apple, Microsoft, and Facebook, that is Meta. Not only the industrial growth, but in our state, we also recognize the pressing challenges faced by our citizens, especially those residing in rural areas. Access to quality healthcare remains a very critical issue. Many citizens unable to avail themselves of essential medical services. It is also our collective responsibility to address this disparity and ensure that every individual, regardless of their geographical location, has access to the healthcare they deserve. We envision filling this gap through public-private partnership, that is PPP model, harnessing the strength of both sectors of change to bring a meaningful change and expanding our reach beyond the boundaries of Telangana to touch the lives of those in rural communities across the nation. The new ambitious initiative of the government of Telangana is not about the infrastructure development. It's about creating opportunity, the skilling talent, and helping to attract the global talent. I'm glad we have so many colleges, and those colleges' principals are here today. We will work together to create next large workforce and align with our Honorable CM Revanth Reddy and our government vision of generating 5 lakh new employment opportunities, providing livelihoods for countless families and individuals across the state. The initiatives for Center for Industrial Revolution Telangana also aligns with it. Out of 3 core focus areas like skilling to provide livelihood and growth opportunities to citizens of state and country, health profiling of each and every citizen, and clinical registries to provide access to better evidence-based care to the people of this state, and promotion of the innovative clinical studies to bring cutting-edge therapies to the market quickly. These initiatives can take India to the new heights of development and improve health quality. This is not just the healthcare transformation, but a social transformation that will have a global impact in the future. By empowering our workforce with these specialized courses and internship programs, we are helping them to be industry ready. Our vision is to expand a strong workforce by skilling nearly 50,000 local graduates over the next 5 to 6 years to make them industry ready for life sciences research and manufacturing. In a week's time, we shall start the pilot batch under our skilling initiative with 2 specialized courses, medicinal chemistry and analytical chemistry. Regarding the clinical registry, we have initiated the process to pilot at 3 sites, starting with hemophilia indication, with a vision to expand it to the multiple indications. Having a clinical registry will not only enhance the healthcare outcomes, but also will facilitate better allocation and utilization of resources. We have also progressed well in our initiative to fasten the validation of the innovative products and devices through a critical innovation sandbox by partnering with 15 clinical sites. This will help to drive innovative studies from India and become first in class. Through this initiative, we would like to set a benchmark and aspire to create a health tech ecosystem that is inclusive, efficient, and sustainable. In this journey, we would like to thank all our partners and founding members who have joined us in this vision and contributed to the success of this center. Looking ahead, Center for Industrial Revolution Telangana envisions creating 10,000 plus new job opportunities in health tech, besides R&D and manufacturing jobs, nurturing 20 to 25 emerging companies and startups, and generating about 10 to 25 novel ideas through its registry. As we embark on this journey, let us create impact together. As a business means impact, and Telangana also means the impact and the great impact. Thank you one and all.
Thank you, sir, for your enlightening words. And now, ladies and gentlemen, with this, we come to an end of the logo launch. Thank you very much to all our dignitaries to be over here on this occasion. Thank you very much. And I also acknowledge the presence of all the college principals over here. Thank you all for being over here. Let us capture this moment. Let us have a photo op. I request all our dignitaries to step towards the center of the stage. Thank you very much. Ladies and gentlemen, we'll be having our next session in few moments. We have very interesting keynote speakers lined up for all of you. I request you all to please be seated after the session. Thank you. I would like to extend a heartfelt gratitude to our Honorable Minister for Industries and IT, T. Sridhar Babu Garu, for being here. Thank you very much, sir, and all the other dignitaries. Ladies and gentlemen, as I mentioned, they're going to be interesting keynote speakers which are lined up for all you people here. Ladies and gentlemen, Let me please welcome on stage Mr. David Ricks, CEO Eli Lilly, for his keynote address. Over to you, sir.
Okay, great. Good morning, everybody, and a pleasure to join you today. Thanks to our hosts, Honorable Minister, and other government officials, and for all the attendees here today at the BIOASIA conference. Really pleased to be with you. And I know you've built this conference over many, many years to one of the premier life sciences innovation forums, and it's an honor for Lilly to present here today. And I want to recognize the work of the state of Telangana to make this really a life sciences hub, not just in India, but on a global stage, building world-class infrastructure, progressive policies that have led to a really strong cluster of both manufacturing and life sciences jobs here in the region. Lilly has been operating in India for about 30 years. And we opened our large innovation center in Bangalore in 2016. And I think Lilly, maybe you have known, but has become more famous lately around the world. But we're an old company. We were established in 1876, nearly 148 years ago, on the principles of scientific innovation, product quality, and our values of integrity and respect for people and the pursuit of excellence. That has made its way to our Indian operations here, both in Bangalore and our commercial operations. And we're pleased to be here and participating in this vibrant ecosystem. And we know that India has taken many important steps to advance its place in the world as a life sciences contributor, with the 2047 plan as one such example. But I'd like to highlight maybe some other opportunities at this special moment in the world that India has. And as we think about investment in India, are front of mind for us. So first, many strengths exist, and I think we can broadly bucket them into three major categories. First, the incredible things going on inside of India, the global situation outside of your country, and of course, the very important changes happening in life sciences. So within India, of course, we all observe the dynamic growth that is both happening now, but even what is more possible ahead. An economy that will surely rise in global importance and outgrow the world in GDP and GDP per household, rising standards of living, and improving the lives of more than 1 billion people in the Indian subcontinent. You've already got a strong industrial base in many sectors, including life sciences, and one could easily predict that will only grow. With stable governance, a rules-based order, a democracy, India stands out as a particularly strong economy for global companies to consider and invest in. Of course, this is also influenced by what's happening around the world, as the period of most of my adult life involved massive globalization and interconnection of global economies. And I wouldn't be the first person to predict that perhaps that process is now slowing or even reversing. Yet, U.S. and India ties are as strong as ever. I think as we look from the United States at trading partners, of course, our historic partners in Europe and Japan, but also emerging economies that share our values of democracy and freedom, become that much more important. This is a tailwind on the already significant acceleration that's happening in India. And then finally, within life sciences, I think we're now in a very unique place, driven by the fusion of technology with early phase development, the explosion of new modalities to treat previously untreatable conditions, and the broader understanding of disease has led us to a place where we can now consider not just treating common diseases with medicines that do a pretty good job, but addressing the fundamental causes of common diseases and specialty diseases alike. Perhaps a bit of that was on display during COVID. It was mentioned here, the role that Hyderabad played in the COVID pandemic, but the industry in total took a previously unknown pathogen and within 3 years had dozens of new treatments and at least 6 scalable global vaccine platforms that essentially made the condition livable. That is unthinkable, I think, in historic terms. Our company has worked hard on 2 other, I think, important areas: the treatment of neurodegenerative conditions. We hope to have approved any day now our breakthrough treatment for Alzheimer's disease, which can slow and potentially even prevent the disease. Our treatments for obesity are making us famous around the world, but obesity is perhaps the primary cause of all adult disease in the developed world, leading to over 200 chronic conditions, not least of which has a major impact on Indian life, like type 2 diabetes, hypertension, and cardiovascular risk. We can now address the underlying cause of these diseases in a very significant way with scalable medical innovation. So I think you'll all agree it's truly a special time for India to reconsider its position in the world in life sciences. A robust and fast-growing local economy, rising standards of living, a tailwind on global geopolitics, and a unique moment for technologies converging to really solve human diseases in ways we've never thought possible before. But to join the globe as a leader in life sciences, I would observe 3 things that probably need to be addressed to drive organic in-country investment and certainly to drive broader interest from multinationals in foreign direct investment. Of course, intellectual property is the root of what we do. We invent new matter and then prove its utility in diseases. Without intellectual property, this 12 to 15-year exercise, costing $3 to $5 billion per molecule, would never be undertaken. And I think it is time for India to reconsider its position on IP relative to our industry and enhance its controls, providing a more consistent period of reward in country and supporting those policies out of country. Regulatory environment is key as well, and we've grown to understand that harmonizing regulation can really be a catalyst for investment in country and for foreign direct investment. Here again, India has many specific policies related to its regulatory environment, all set up for good reason, but in hindsight, perhaps we can reflect upon them and find redundant policies that only cause delay and extra cost, which has a 2-way effect of reducing new medicines from companies like mine to join the Indian market and reducing the ability of local biotechs to export their inventions seamlessly across the world. And finally, the creation of a social safety net, as we have in many developed markets, and beginning that process in a significant way so that daily life for Indians can improve and medicines can be the scalable and affordable method to enhance the health of this country. Whereas I would point out hospital care and physician care, while vital, is very difficult to scale and certainly is not long-term affordable. IP I've commented already, and there's a long and important debate that's been centered around the developing world, the so-called global south, and the developed world. I would stand here today and point out that that debate, I think, is largely a false narrative. We can have affordable generics that are broadly available for common diseases. We can make sure medicines are affordable for the developing world, and at the same time, support intellectual property to create tomorrow's inventions, like our breakthrough Alzheimer's and obesity therapies that can serve the globe as it develops. These are not incompatible ideas, and I would invite policymakers in India to embrace that idea and collaborate with other developed nations to form a 2-track system that can support both types of products for medical need, commonly used medicines that should be affordable for all, and new medicines that can reach this population and others to really address the leading causes of adult disease in the developing world. Of course, regulatory barriers I've commented on. Here, India does not stand apart, but would just point out that over the last 20 years, there's been tremendous convergence between EMA, FDA, and Japanese regulators, and more recently, the Chinese regulators, which have created enormous efficiency in developing medicines for those populations. To the degree there are differences, it creates a less fair, less transparent environment for Indian citizens to access global innovation, and it's actually a handicap on Indian companies to globalize their own innovations. Harmonization is a multi-step process. It won't happen overnight. The current system was invented for good reasons, but a careful analysis of it and unwinding may be helpful. And I know that the global industry would support India further embracing the International Congress of Harmonization rules and beginning to lower these barriers, which don't add to the health of its citizens, but perhaps slow down new innovations in arriving here in India. Of course, pointing out as well that the burden of disease is changing in this country as it has in so many developed countries, and the need for new medicines has never been greater. Non-communicable diseases now constitute the vast majority of deaths for adults around the world, and the vast majority in low and middle income countries as well. Of course, India is a low, middle, and high income country all within one border, but we often think of it in the middle income category. Here, NCDs are dramatically shifted with income, but as the nation rises in importance, this will become even more important. And NCDs contribute to more deaths than communicable diseases in the low and middle income world. Today, you may know that diabetes is a uniquely Indian problem. Soon, India will exceed China in the number of people diagnosed with diabetes, and already has the world's largest obese population, which is not a lifestyle choice. It's a preconditioned disease to many metabolic conditions that afflict adults, diabetes included, along with hypertension and cardiovascular events and stroke. These will become preventable with medicines like that my company makes. And I think embracing that innovation will be critical to the success and longevity of India's economy and its people. We note already great progress on enhancing the social safety net for many Indians, the new government finance system to reach so many. In India, over 514 million people now extended some basic insurance, but this is inpatient only. So for physicians in hospitals, that's important. That's a basic first step. I think we would call to expand that for common diseases like diabetes, where you can self-care at home. Again, a more scalable, low-cost model to reach so many in India. You may say this is a difficult and expensive task, and it will be, but I spent an early part of my career in another large populous country that was developing, and I know sensitivities exist between India and China, but I'll just point out that in 2000, China had roughly 15% of its population with some form of basic insurance, and today it's virtually universal. As the economy grew, the government invested in that social safety net. They built nationwide digital systems to implement this, and it's been hugely successful. We can have our debates about how China does its business, but as it relates to supporting basic health care, this is a giant success. And I think there's a parallel, actually, in India with the banking system, which is now legendary around the world. Here, skipping over 100 years of the way the rest of us do banking, going directly to mobile devices, introducing very low-cost, low-friction banking for every citizen in this country, and it's a legendary story. This is possible with health insurance. And I think we would point out that such a move could really propel India to both have better health for its citizens, but also a vibrant life sciences economy that would move it rapidly up the ranks of interesting places to invest for foreign investors and domestic investors alike. So I stand here today looking at India with a lot of excitement Of course, the talent in India is fantastic. We have a growing large operation here to support our global company because of the intelligence and work ethic of so many Indians, and we're grateful for that. I look at India's progress and the momentum it has domestically, the global tailwind it will have in the coming decade because of geopolitics, and the convergence of life sciences with scaled technology. One can only think about the possibilities of computer-driven drug design using AI to solve even more problems than we've solved already for human disease. I don't think it's an exaggeration to say that the possibilities are nearly limitless as we approach the future. But the limitations will be in our own history of our linkage to policies in the environment that may constrain investment and let other countries leap ahead of the opportunity before all of you. Addressing IP, drug coverage, regulatory barriers are all problems we can solve together. And Lilly stands here watching what can happen here in India and excited for your future and perhaps our future in it. Thank you for listening, and enjoy the rest of the conference.
Thank you very much, sir. I request you to please stay back on stage for a few more moments, and I request Mr. Ajit Shetty, International Advisory Board, BioAsia, to please join me on stage to hand over a small token of thank you, or memento, to Mr. David Ricks. Now I think would be the right time to give a huge round of applause. Yes, thank you. Thank you, sir, to do the honors. And now I would like to invite on stage our next keynote speaker, Mr. Jeff Martha, Chairman and CEO of Medtronics. Wow. That was an absolutely warm welcome. Can we do that again?
All right, thank you. Okay, so I've elected to move away from the podium, so I'm glad to see that this lapel microphone is working. I know a lot of you have been through a number of presentations this morning, and some of you have traveled from a long way to be here at BioAsia. So I've decided, again, to move around a little bit, and also I've included some surgical videos in my presentation, guaranteed to wake 99% of you up. 1% of you may pass out, so I'm just warning you now. Actually, I've got to grab the clicker here to keep this going. Sorry about that. Didn't really think this all the way through. But first of all, it is really exciting time. Let me click through, get my picture off here. All right, and we'll keep going. All right, so the slides aren't going through. Okay. And you see them? Okay. There we go. So first of all, it's great to be here for this momentous occasion of Telangana and Hyderabad being designated a healthcare and a life sciences hub. It's well deserved, and congratulations to everybody that contributed to that, including my colleagues at Medtronic. And we're also celebrating the future, because there's a lot more to come and a lot more to do, and that's what I'm going to talk a little bit about today. It is a really exciting time to be in healthcare. You know, we're learning so much about how the body works. You heard Dave Ricks just talk about some of the innovation going on at Lilly and in the pharma industry and biotech. It really is amazing We're learning so much more about how the body works. And in parallel to that, the technology is advancing at a rapid rate. And this virtuous circle is creating, some wonderful new therapies for patients. And as we learn more about the body, we learn how to apply technology to alleviate pain, restore health, and extend life. That's what we do at Medtronic. And conversely, as technology advances, that opens the door to a bunch of new therapies. And whether that's, I even brought a little prop with me. You get those zoom lenses out. You're going to need the big zoom lens here. Whether that's shrinking a pacemaker down to this size and eliminating the need for a surgery to implant the pacemaker, and instead we use a catheter, so no blood, or whether you're treating something like Parkinson's. We now have the ability with sensors, with the advancement of sensing technology, to sense signals in the brain. And so we've been treating Parkinson's for 30-some years now with the neurostimulator. But now, because it was for 30 years, it was a one-way conversation, but now we can sense signals in the brain and we can listen to the brain. And that enables us to customize that therapy for that patient over time. So as their neurodegenerative condition, as Parkinson's progresses, we can change the therapy real time and make sure that patient lives symptom-free. Or something we just got FDA approved in the United States, and it's also got approval around the world, including here in India, a brand new to world therapy for hypertension that dramatically mitigates the needs for drugs, which people don't like to take. It's a day procedure. You're in and out in a day, where we apply energy to some nerves around your kidney that reduces the hyperactivity of those nerves and brings down your blood pressure by double digits. And we've got data going out to 10 years. We believe this is a permanent reduction. And the impact to stroke and heart attacks is just dramatic, as hypertension is the #1 contributor to death in the world. So there's all kinds of new things that's exciting to think about, that are here and real and now. But today I want to talk about the application of one mega trend in healthcare, and I'll talk about how it impacts medtech, and that is artificial intelligence. You hear a lot about it, whether it be large language models like ChatGPT, or you hear these different terms, deep learning models, machine learning. I'm not going to get into talk about all the difference, although I will say what we're using in our industry right now, more or less for the products I'm going to talk about, is more machine learning and deep learning, and it's having a profound impact. So I'll give you a few examples, but as I walk through these examples, I'd like you to keep a couple things in mind as you think of it. This takes partnership with states like Telangana, partnerships with physicians, many of in hospital systems, partnerships with big tech companies, and you'll see that throughout the presentation. That's one feature of how we're using AR. Another feature is ecosystems. And so in our industry, we used to create, standalone widgets. You think about the pacemaker I showed you. Even this little guy is part of a larger ecosystem. It's Bluetooth to your phone now, into the cloud, where we can monitor this thing. Patients that have a Medtronic pacemaker all have an app too on their phone. So even this is part of an ecosystem. And you'll see that AI is central to these ecosystems going forward. And then finally, those are two features, but a benefit, and some of these examples are here today and some are coming, is all this just makes these cutting-edge therapies more accessible to patients around the world. And that has been a big challenge, and I do think the introduction of digital technologies, whether that be data or AI, cloud computing, 5G, 10G, or robotics, into the medical device industry is ultimately going to make this cutting-edge healthcare much more ubiquitous and dramatically drive up access around the world. So these are themes I'd like you to take into consideration. So let me walk you through a couple examples. This is where the videos come into play. So you can't help but notice the rise of cancer around the world. Colon cancer is one of those. And what we do at Medtronic is we look at these big problems in healthcare and try to flip them and say, well, there's an opportunity for us to apply medical technology to help solve these problems in one way, shape, or form, or at least mitigate them. You know, in our mission, alleviate pain, restore health, extend life. So colon cancer is one of those, and given our position with GI docs around the world and in the GI interventional suite, we thought maybe we could do something here. And so what we realized when we looked at this, and the rise of colon cancer is multifactorial, but one issue that we thought we could fix is the diagnostic phase in colonoscopies, which is the standard of care, where we found in some clinical research that physicians, and this is a very mature procedure, physicians were missing 26% of the polyps. It was a good idea. Well, there we go. It's 26%. And so what we said, how can we apply AI to solve that problem? So that's what we did. That's what a GI doc, a gastroenterologist, is looking at in a colonoscopy. So I hope most of you, if not all of you, have had a colonoscopy. If you haven't, I would suggest you get one if you're 45 or above. And that's what the GI doc is looking at as they're going through that procedure. And what they're supposed to identify is tiny little abnormalities, in your colon. And that's, I said, it's very difficult. We found that they're missing a lot of these, and particularly as they get tired, as the day wears on. They do 8 to 10 of these a day. As the day wears on, their diagnostic yield goes down. So what we did is we developed an algorithm using 13 million colonoscopy videos to develop this algorithm that, as we've rolled it out, got it approved by regulators around the world, we have found that it is 99.7% accurate and sensitive. Thank you. With no false positives. So we're right. We find these polyps 100% of the time, or virtually 99.7, and we're never wrong, and it never gets tired. So let me show you how it works here. So now that's the active video. Again, that's what a colonoscopy, that's what a GI doc's looking at. And then with GI Genius, you're going to see these green boxes pop up. Those are polyps. Now, I don't know about you, I can't tell that there's a problem there, but there is. And those green boxes identify it, and then the doc can easily take those polyps out before they become cancerous. And how, I told you how we developed it, how we deploy it. We've put an NVIDIA-powered edge computer in there to do the real-time processing. So this is a kind of a real-time processing. You need to compute right in the OR or in the interventional suite. So you can see there the ecosystem. You can see how the outcomes are improved. And in addition to this, it even goes one step further. We've created with NVIDIA a innovation center where we're inviting the AI development community to develop other AI algorithms to be used in the interventional suite, because these docs are putting those scopes in both ends, down your throat and the other end as well, and there's all kinds of opportunities to use AI to make those therapies better. And it's the thing that I like about this is it's inviting healthcare, non-healthcare innovators to come on into healthcare and help us solve these problems. And it removes the barriers for innovators to get into the medtech space. And as they innovate and come up with these new algorithms, we can serve as a distribution arm for them. So it's a very exciting concept that we want to apply across other areas in medtech. Here's another one. Now this is one that's in the making. That one's here, it's now, and we've priced this thing so that it's affordable and can really get out to everywhere in the world. This one is something that's a journey, and this is surgical robotics. So moving from open surgery to minimally invasive surgery to ultimately robotic surgery. So you hear a lot about robotic surgery out there, but the reality is only 5% of the procedures worldwide are done robotically, and 20% in the United States. So that means if 20% in the United States, 5% worldwide, that means in a country like India, it's almost zero, okay? Because the cost is high, the technology is still new, and the cost is kind of high. But over time, what this is going to do is going to have a huge impact on healthcare. It's going to make today it's making physicians that are highly trained physicians use these robots, and it makes them that much more precise, that much more accurate. But you're still relying on the training of the physician. That's the paradigm we're in, because they're operating this robot. But over time, as we integrate other technologies into the robot, visualization, imaging, navigation, and AI, think of driver assist in the OR. So that's where we're going with this, where physicians will have a guided surgery. In addition, we'll have AI, developed surgical plans customized for each patient. So you can see where this is going. It's very exciting, but it's still not nearly as ubiquitous as it needs to be. But as technology advances, we're committed to get this cost procedure down to the same as it is today for laparoscopic surgery. So that's our commitment. We've got a number of, our version of our robot is called the Hugo. This is a picture of it here today for soft tissue surgery. We have a number of them here in India. We have one of our 14 training sites in India to train physicians, but not only to train physicians, but to get feedback to how we can innovate this robot and evolve the robotic system. And again, like I said, it's more than the robot. It's the integration of multiple technologies, including AI, to develop that driver assist technology that'll democratize good surgery, because we will never have enough highly trained physicians around the world to satisfy the number of surgeries that are going to be needed. This technology is the path forward, but again, it's on the market today, but the true, real impact it hasn't nearly been felt yet because of what needs to be done here. Now here's another one. I'm going to end on another one that is today, here and now. And this is kind of an interesting part of our development. This is what we call this touch surgery enterprise, where we're putting another one of these edge computers into the surgical suite, recording everything that happens, the instruments that are used, how long they're used for, what the surgeon's, the order, how he does or she does the procedure, and taking that video, and what we're able to do with it is to, real time, we process it and then make that available after the surgery on the surgeon's phone, broken down these procedures into the multiple steps of that procedure, whether that's 8 steps or 10 steps, and everything that happened during that procedure, and annotate it for that physician. This is a great way. You can see here, this is what the physician gets after they walk out of the OR. It's too small to see all the data that's on there, but you can see the video, and we light up different structures to show them what they did, how they did it, and then they can compare themselves to themselves, what they did in their prior surgeries. They can compare themselves to other surgeons in their health system, or a broader list of de-identified surgeons in terms of how well they did, how long it took, the cost associated with the procedure. So it's akin to an athlete after they're done with their sporting match, whether you're a cricket player or a football player or whatever, breaking down the film afterwards. And again, this is a great way to train physicians, and it breaks down geographic barriers, because this can be done on a global scale. So again, and then we're taking all these surgeries. We have, tens of thousands of surgeries recorded, and we're also using these same surgical videos to develop that driver assist technology that I talked about for the robot. So you can see, I hope you see the themes that are coming together here, whether it be the ecosystem, the partnership, health systems, technologists and developers outside of the healthcare ecosystem, even bringing them into the ecosystem. It's a very exciting time. And but I'd say one of the things at Medtronic we're most proud of is the number of patients we serve. And I'll end on this note: 2 patients every second. We're very proud of the fact that we're usually the first med tech company into the emerging world, emerging economies. We train physicians. We help patients. 2 patients every second. But that's only 80 million people. Just in this country alone, there's 1.4 billion. So our goal is to get that 80 million a year up to 1 billion a year. And I really believe that the unlock is digital technologies, robotics, data, AI. And AI is at the foundation of it. The robot's cool to look at, but AI is at the foundation of it. Data and AI. Data will be the foundation. Data will be the basis of innovation. Data will be the currency of innovation. And it can be shared across boundaries. And I think it's going to be the unlock to get us to that 1 billion patients a year served. And it's a lot of that innovation is happening right here in Hyderabad. And I couldn't be more proud of the role that we play. at Medtronic, and I couldn't be more excited about the future. And, I talked a lot about technology and partnerships, but at the heart of this is the patient. And our goal is to make all this technology much more ubiquitous to get to that billion patients a year. So thank you very much.
Thank you very much, sir. And to acknowledge your presence here, I would like to call on stage Paridhi, Vice President, Medical Devices, Government of Telangana. Thank you very much, sir, for being here. I request you please take a center stage. I need not request for the round of applause. I know that he's going to get a thunderous clap here. Thank you very much, sir, for being here. And for our next session, to take the next session forward, I request Tarunam to please take up the podium.
Good morning, everyone. Moving on from some really inspiring keynotes, we'd like to start the day with our first panel discussion on leading the We're expecting the speakers to be shortly here. We'll start the session in about 2 minutes. Ladies and gentlemen, we'd now like to start with our first panel discussion of the day on the topic of leading the health tech revolution. Please put your hands together for our esteemed panelist, Mr. Diogo Rao, EVP, Chief Information and Digital Officer, Eli Lilly. Mr. Greg Mayers, EVP, Chief Digital and Technology Officer, BMS. Ms. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals. Mr. Fani Mitra, Chief Digital and Information Officer, Dr. Reddy's Laboratories. Mr. Scott Burgett, Director, Health Engineering, Garmin. Mr. Sriram Rajamani, Corporate Vice President and Managing Director, Microsoft Research India.
You're writing your name.
Moderating the session would be Mr. Jeremy Jurgens, MD, World Economic Forum and Head of the Forum C4IR. Please put your hands together for our panelists.
Thank you for joining us and here for this session today. We're going to try and run this in a relatively interactive format. We'll have an open discussion here among the panelists in discussion. And if there's time, we'll also open it up for questions to the audience. So if you do have questions that come up during the discussion, and we'll then have a chance to call those and bring those forward towards the end before we wrap up there. Now, as we've heard here, we're hearing how the advanced health technologies are driven by artificial intelligence. And they've been making impact across the entire healthcare value chain, from understanding better specific conditions, on discovery, development of new treatments, and new opportunities with healthcare delivery, including preventative care. Now, I'd like to just jump directly in with questions. So my first question will be to Ms. Sangeeta Reddy from Apollo Hospitals. Could you share with us how some of the digital tools, such as telemedicine and virtual care, that have been adopted by and driven by Apollo Hospitals? And what impact have you observed in actual settings, in kind of real-life settings? And any kind of key prerequisites that you'd have for adaptation that you would share with other leaders here in the audience there. Sangeeta, over to you.
So good morning, everyone. Wonderful to see you all here. And as you probably figured, the question could take half of your session, but I promise you I'll try and encapsulate, a lot of things which are happening. But clearly, as we all understand, there is a global shortage of healthcare workers. There is clearly a lack of doctors and nurses. The ratios are abysmal across the world. And with the new technologies, rising procedures, and more incidents of non-communicable disease, as well as the aging population, many factors are compounding this problem. So digital is clearly the way to go. We at Apollo Hospitals actually began our journey with telemedicine 24 years ago, when we connected a small village. Thank you, it's been a fantastic journey. We connected a small village in Andhra Pradesh to our hospital and diagnosed a hole in the heart on a young girl in a village. 24 years ago, she had surgery. 4 months later, today she's married and has 2 children herself. So this child would not have been diagnosed. They would not have traveled to a city. She would not have had surgery, and she probably would not have lived beyond the age of 12. So the ability to take doctors and capability into untouched environments is one of the first most powerful tools. And for this, we've moved from, telemedicine, which was 3 telephone lines put together, to satellite technology, to today using the truly ubiquitous bandwidth which is available across the country and across the world. So that's a connectivity platform. Now, layering on top of the connectivity platform are multiple tools: multimodal, multi-language patient communication, AI-enabled using NLP, ML, and analyzing about 5 million records. We've created a clinical intelligence engine using AI. So when you embed that on top of every EMR data capture, you are increasing accuracy. Then we move into throughput optimization areas, whether it's auto generation of discharge summaries or using devices to create virtual care, and therefore you reduce the number of code blues, you monitor patients at home, you save nurses time. So in multiple areas, so greater clinical accuracy, upskilling of nurses and other healthcare workers so we can do more, and throughput optimization are three large buckets. We have created a series of AI which sit on top of our platform. We used first the ISO of software as a medical device certification. We've now gone into BSI registration of our AI. We also host some of our AI tools on the Azure cloud, so they're available. We have also a partnership with Google. One of my favorite ones is a project where we've created just X-ray analysis for automatically picking up TB. As you all know, TB is a large, kind of a pervasive silent killer. It's important for us to be able to diagnose and treat quickly. So if every time you were having an X-ray, if you also did a TB check, so this is just an AI tool sitting on top of it. And the beauty is that hopefully we will not only be launching, but be able to give it to all government hospitals free of cost. So my excitement is about using the data we've been capturing for years, converting it into clinical insights and algorithms, embedding them onto all kinds of hospital information systems and patient interaction enablement, so that we have either patient queries or CDSS enabled by AI, therefore elevating the quality of care. There are multiple others, but I'm going to stop at this one. Thank you.
Okay. Thank you. Sangeeta, before I go to Diogo, I'd like to actually just follow up on this question of skills and this tension between upskilling and also displacing labor. And at the moment, do you see actually more augmentation in terms of supporting or assisting current healthcare workers and adding new jobs, or do you see this more likely to cover the shortage, or potentially in some places even displace workers? What's your attention on those elements there?
It's an absolutely great question, which you prefaced with "at the moment." So at the moment, I see both happening, but I do not see any time in the near future, and I'm very clear about this, AI will augment the healthcare worker. It will not displace the healthcare worker. AI will displace certain tasks, mundane, repetitive tasks which the healthcare worker needs to do, therefore enabling them more time to do more, to spend more time with patients, and not have the kind of overworked, difficult environment that many healthcare workers have. So it's augment, it's assist, it's enhance quality, it's not displace.
Great, thank you. I think that's reassuring for many people in the audience and also in the sector there. Diogo, I'd like to come to you. And how has AI been used in the process of drug discovery and development? I think if you look back a decade ago, we thought there would be this revolution there. We didn't necessarily see all the gains from that. Are we at a kind of a new wave, or have we just kind of under-recognized some of the progress that was already being made there? And where do you see the biggest implications with the current kind of AI tools as they're being utilized?
Well, first of all, I'd love to say thank you to everybody for coming today, and thank you to the host for inviting us here. I haven't been to Hyderabad since before COVID, and I'm glad to find out that the food is as awesome as always. I'm planning to eat a lot of it today. In fact, every time I come here, I end up with a kilo or two extra on my way back. But back to medicines. Drug discovery is at the heart of the applications for artificial intelligence for us. And it's an incredibly exciting time because our machines truly are generating molecules that no human would have imagined. We had one colorful example we had from last year was we took a few molecules that were machine generated that had really unique structures that actually didn't look like anything that we really knew much about. In fact, they only were somewhat similar to 3 molecules in our database, and even then, that was kind of remotely similar. Well, we had generated 3 or 4 of those molecules And we took them to the chemist and we said, tell us what's wrong with these molecules so we can train our models better. And the chemist said, hey, that's interesting. We hadn't thought about doing it that way. And so then we decided, let's go make those molecules. And actually, one of them is still in the running right now as a candidate. But one of the things that I think gets lost in the whole discussion around AI and drug discovery is not just how we train our models, but how our models train our humans. And if you do this right, it's a loop where it's not just a computer versus the human and trying to figure out which one comes out better. But I think we're going to be able to do anything that no human could have done on its own, no machine could have done on its own. And, okay, wow, I appreciate the applause. Thank you very much, sir. Voting for the humans or the machines or the combination? Okay, all right. I do think that I do think there are incredible opportunities all around. Maybe one more colorful example I have from Discovery was just earlier this week. I was in Bengaluru and visiting my team there. We saw some great work from the team where we were stabilizing one of our medicines, not the active pharmaceutical ingredient, but the preservative that we put it in. And we need it to work in a wide range of temperatures, and these can be very complicated. You don't want it to affect how the molecule works. Well, this is a very laborious process in wet labs. And what we did instead is with the team in Bengaluru, they had actually done everything in silico, figured out the best preservatives possible, and it turns out it was better than anything that our scientists were thinking. And in probably an ironic switch, all of the thinking that we did and all of the design here came from Bengaluru, and the team in Bengaluru then outsourced, offshored overnight to the wet labs back in the United States to go synthesize the molecules and see if they actually produced what came out of the models. And sure enough, it did. And that's another example of something where if we had just kept doing it the old way, and we had scientists in wet labs, we would have spent months and months and not ended up with as good of a solution.
Great, thank you for that. I'd like to actually go into this topic of health data. I'd mentioned in my remarks earlier that 97% of the health data often goes unused. And I'd like to maybe direct this one to Greg at Bristol Myers Squibb. Now, how do you use health data in your organization, and how is AI changing the way you think around the data you have access to, as well as the data that sits within the ecosystem of your partners?
Yeah, I think when we look at, first of all, our role is very similar to Diogo. We think about technology, AI, digital as being something that helps us accelerate the discovery, design, development, and ultimately bringing to market medicines, right? To bring more medicines to more patients faster. And when you think about the data, I think we could get back into the research area that Diego was pointing to. I think in most life sciences companies, you often think about, so experiments is the lifeblood of how we do our work. And most scientists sort of think about the experiment, like the means to the end is I have to run an experiment to prove or disprove whatever it is I'm trying to prove, whether it's bioreactivity or something like that. And then the data that comes off that experiment just kind of is exhaust. It just kind of goes into the ether. And you really have had to shift the mindset within the company that data being recaptured and put back into the ecosystem so that it can be retrospectively interrogated is a fundamentally different mindset. Because you go from exhaust that comes off of an experiment to something that becomes really the mine in which you can do everything. And I'll give an example of something that we've done. So there's a form of non-small cell lung cancer that has a genetic mutation that typically affects non-smokers and younger people. And about 40% of the time, people diagnosed with this form of lung cancer will actually find that at the point of diagnosis, there'll be a metastasis in the brain. And the conventional therapies for that, they work pretty well, except after about a year or so, patients will become resistant to the drug. And what we found in our protein homeostasis program is that sort of protein degraders actually aren't subject to resistance the same way traditional biologics are. The problem is they can't cross the blood-brain barrier. because of issues around polarity and hydrophilicity and things like that. And so being able to use the sum of all the experiments we've ever run allows us to understand really specific features at the computational chemistry level. That allowed us to actually sort of iteratively design the molecule where we were able to ultimately get into the clinic the first ever protein degrader that can cross the blood-brain barrier that is effective for this particular type of cancer. And that really just would not have happened without being able to go back and sort of triangulate across all the experiments that you've ever run before, because you're really getting down to small little side chains on molecules that get released. I think the other area when you get into drug development, this is where, we all feel this pain that drugs take a really long time to get to market. And in generative AI, it's been really exciting that when you think about all the cardiovascular trials that we've ever run, which have been thousands, every time you start a new trial, you have to kind of start from scratch with what is the clinical protocol you're going to do to run that trial. Well, what Gen AI has been really great is you take the sum of all the trials that you've ever done, and you basically allow an AI tool, a Gen AI tool, to be able to get you a median sort of summation of all those other trials. That has allowed us to shave really months off of getting the protocol started. And then maybe just one last thing around this, which has been really compelling, is when you take something like a protocol and then you start getting patients involved. Something as simple as an informed consent form, which most of you know what that is. It's asking a patient, letting them know what they're really signing up for. These things are written typically by doctors and PhDs. And so you have just, imagine your grandmother having to sign a form that says something like advanced hepatocellular carcinoma. Well, Gen AI is able to take these protocols and actually sort of get it down to a more accessible language level. And so now we're finding our informed consent forms actually use words that patients can understand, which actually didn't happen before because they were written by PhDs and MDs. So there's just been so much value, but all that only works when you're able to capture the data that institutionally you've had of all the other experiments and compounds and trials that you've done before, because that really is the playground that allows you to generate all the new things.
Yeah, I love that example of, kind of simplifying this language and in a sense almost actually helping doctors, healthcare providers become more empathetic, right? So they can spend the energy on that and kind of simplify the argument there. Now, maybe I'd like to come to Mr. Fondimitri from Dr. Reddy's. So, heard AI, data, and some of the positive examples there. Could you share from your experience and what you're seeing there, also on some kind of positive applications that you've seen or emerging?
Sure. I think there's a little bit of context here in terms of the industry itself, because representing the generics industry, if you look at the three big shifts that are going on, right, in terms of the products becoming more and more complex. The peptides and the associated complex generics is one big shift that we are seeing, and hence the first to market on some of these complex generics is obviously a space that is of importance to the business here. The second one is obviously around the manufacturing and quality, and there is a joke that pharma industry produces more paper, or at least as much paper as pills in the past. But that meant a lot of data, which is now digitalized, is available for us. So there is obviously opportunities, in terms of what we do with that data in the manufacturing and quality space. And the third one is essentially around the commercial go-to-market models as you take these affordable, accessible medication to a larger group of countries. And it has its own set of use cases that come along because of it. A couple of them that Greg and Diogo talked about in terms of using the experimental data. So how can you reduce the number of experiments, move as many as possible in silico, so that you can actually expedite the drug development process is obviously a use case and a space for us. That's certainly exciting for us. But a large chunk of work is also now in the in silico digital twinning of some of how these products get manufactured in the plant, because as the process of transfer from lab to the plant actually becomes more and more complex, there is a potential for failing this as you scale up. So there is a lot of AI-led interventions that we are thinking of in that space, essentially where you actually can predict the scale-up outcomes even without taking it to the plant. So there is essentially work there. And then there is a part around the regulatory, because the amount of regulatory work that goes into filing this product and getting a first-time approval and a lot of a lot of our friends in the industry would appreciate that is as you take it to more and more regulatory bodies across the globe, the amount of work that's involved, essentially is a huge drag on productivity and time to market. So generative AI essentially for us plays a big role in that space of how do you create these regulatory documentation that is both effective and first time right, and take the products to the market, fast enough, right? So that's the space, and of course we talked about the industry 4.0 use cases around yield optimization, around scaling up, and products in the plant, etc. is another large space for us, Jeremy. And the go-to-market models, and I'm sure again digital health shows up big, and one thing that happens when generics go to some of these markets is the access suddenly doubles or sometimes even triples because of affordability. And if we are able to combine the access with the digital health interventions, there is an opportunity for us to actually explore what that patient data and the patient support programs can do back to the drug discovery itself. But that's a slightly unexplored out there use case right now. But the ones in the R&D and manufacturing are pretty strong for us as we speak now.
Great, thank you. Now, I'd like to actually look at use of data technology, say in the non-clinical setting. And Scott, you're joining us from Kansas, representing Garmin. And I have a lot of friends that are into like distance running, ultra marathons, these crazy things. And I know Garmin's their kind of watch of choice for those activities, in part both as a time tracker but also as a wellness device. Could you share with us how these kind of wearables and other devices are being used to improve wellness, and also how you see the technology evolving in this space?
Yes, thank you. This is my first time to Hyderabad and Telangana, and wow, I am impressed. You've got something really special going here. The health science stuff is really going well. So I'm not an AI practitioner like some of my panelists here, but I am a device person, I'm a wearable person, and obviously AI is about data. You have to train your model, right? It's only as good as the data you put into it, and there's really a revolution going on right now with wearable devices and the amount of data that they create that's objective and very rich and detailed. Our Garmin wearables, we have biosensors that measure your heart rate variability, beat-to-beat interval, your pulse ox, we have accelerometers, we have gyroscopes. This data is being measured now 24 hours a day, 7 days a week. Our battery life is so good that people rarely take them off. They only have to take them off every 5 to 7 days. This is a revolution in objective data coming from people wearing these watches, and it's really different than the way healthcare has ever been delivered, which is really episodic. You go to the doctor and you get a snapshot in time. And it's really creating lots of, I think, pain points in the industry. There's a couple I'll just touch on. One is our wearable devices are not medical devices. They are consumer devices, although they have very, very high quality sensors. We don't want to make them medical devices because if we did, it would take us 3 or 4 years to do a single watch. We do a watch, our product development cycle takes between 12 and 16 months. We have to do that to stay relevant in the market, so we can't be regulated. But we are very, very invested in making the highest quality watch and the highest quality biosensors that are available. So we have this huge amount of data, and yet we have to somehow get it into the hands of people who can use it, folks who know how to write generative AI. And so, we are solving some of those problems with just our connectivity solutions, but even then, what do you do with that data? Healthcare providers don't really know what to do with it. A doctor goes to work in the morning, and what's he going to do with, here's the last 3 months of Scott's heart rate, all the time, right? What do they do with that? We have to get the data into medical records, and we have to come up with ways that we can distill this information down so that it's actionable by a healthcare practitioner without, looking at it and saying, what can I do with this? So I think that, kind of from a bottom-up approach, we have a revolution in just the amount of data that's being available that's really objective. And now the question is, how can we leverage that for monitoring people remotely and making sure people on therapies don't decline and manage their chronic conditions. So it's really an interesting space, and I'm really delighted to work in it, and we'll see how it goes in the next few years. There's a lot of change coming.
Hey, Jeremy, can I build off of Scott's point?
Maybe I bring in Sangeeta and then, yeah.
So I'm extremely excited to add something to this, because I believe that the data that you're continuously capturing can have transformational value in early predictions. So one of the things that we have done is created a Asia-specific cardiovascular disease risk scoring. And this risk scoring is now sitting at the back end of one of the large device companies on the personal wearables. And therefore you're predicting, and all of us know that disease presentation is differential based on genetic makeup, but also that the body is continuously giving out these signals. If you can analyze this and put clinical insights or risk prediction scoring into it, you will proactively diagnose someone before the event. I love the fact that if someone's playing golf and he's having a cardiac problem, you're going to predict it because of his device. But I love even further that you predicted it months earlier because you've been tracking him for days. So the AI cardiovascular risk scoring device is now being used as a population health initiative for an entire country. I'm not privy to name the country, but we worked with Microsoft, used our data and built this model. And I think it's extremely useful. It's initiatives like this of working, your device, lots of data, our clinical insights, AI engineers coming together to create impact for individuals. Yeah. So super excited, look forward to further discussions.
Great. Greg, if you want to build on that, and then I also heard Microsoft mentioned, so I'm going to come to Shriram after that.
Yeah, well, we've actually built a couple of products. I just wanted to build off. I'm all equally excited around wearables. So one is we help Fitbit build their atrial fibrillation alert, of which millions of consumers have used it. We think that tool has probably prevented tens of thousands of strokes worldwide, which is really obviously very exciting. And the other thing is there's a heart condition called hypertrophic cardiomyopathy, which is basically an excess muscular growth within the heart, which constricts blood flow. This is that disease, if you hear of young people who sort of die over playing football, this is that kind of a disease. And what we have found is we got FDA clearance for an algorithm that using a simple 12-lead ECG can actually find the signatures of this disease. This is a disease that even the most experienced cardiologists will often miss. The average patient will go 2 to 3 years being misdiagnosed before they actually find this at work, and it's just coming from a simple ECG. And then one last example of something we're excited about now is in the area of cellular therapy, this is a really exciting new way of treating cancer. But sometimes what happens with patients when you do immuno-oncology treatments, what happens is you have the body begins to attack itself through cytokine release syndrome, and we're seeing that very simple wearables, like something similar to what a Garmin can do, whether you look at heart rate variability, respiration rate, actually can give you potentially hours and hours of early warning indication that cytokine release syndrome may be happening, and that could be a life or death opportunity to intervene. And this is something that just, rather than hospitalizing patients for cell therapy dosing, to be able to send them home and give them a wearable device. It could be really transformational for them and also transformational for healthcare systems who can't afford to take up bed space just dosing a patient to make sure that they don't have some adverse event. So.
Great, thank you for that. I think this touches on an important element, and it's also this aspect of trust and trust in technology. And we need the trust of the healthcare providers. Where does the data come from? How is it being used? Where does it go? The patients, the caregivers. And with a lot of the business models that have been used by some companies, it's actually destroyed trust to a certain extent. And so we see this tension in the environment of, okay, is AI something to fear, or is it something that will actually be beneficial? And how can we assure trust in AI and other complex technologies. And I'd like that actually to address that to Shriram, given your experience and also Microsoft's kind of position globally in actually working with governments and businesses to establish that trust.
Yeah, thank you. Thank you for inviting me here. So I think trust is a pretty complicated thing, I must say. I mean, there are many layers that you have to think about, both technologically as well as intent policy, in order for you to have trust. I mean, the first level is security. Security is by making sure that only the people that have the authority to access data actually can access it, and hackers are, you don't want hackers to infiltrate a system and access that data that they shouldn't be accessing. I mean, I think is the rock bottom layer of trust. But even if you have a secure system, and today actually cloud systems are pretty secure. I mean, they are more secure than you keeping data in your own computer. The cloud systems public clouds are more trustworthy because of the experience that we have had as technologists in building them. But even if you have a secure system, privacy, as you were saying, is about, even if you have access to the data, what are you allowed to do with it, right? I mean, maybe you're a hospital, you have access to patient data. Have you taken consent from them? And what kind of operations are you allowed to do on the data? For example, can you train a machine learning model with it? And does that machine learning model now leak individually identifiable information? So those are more higher level concepts about privacy that I think one has to think about. And then I think one has to really think about incentives. Not sharing data at all is not going to unlock, it's going to keep its value locked. At the same time, sharing too much is non-trustworthy as well. So we have to be very transparent about what we do with the data. Transparency, I think, is sort of the third layer on top of security and privacy. And I think the reason why all of these things are coming to front right now is that maybe even 5 years or 10 years ago, right, it was pretty hard to build a machine learning system. I mean, you required a lot of skilled people, and it took time to build one, right? Now with these general purpose AI models, it's very easy to build applications. The rate of building AI applications is easier. As a result, you have to think about transparency, what your intent is, what the incentives in your system are, and then make sure that you layer them on top of security and privacy layers that cloud systems provide. So I mean, all of that is possible. Right now, much is possible, but you have to take care to ensure that what you're doing is completely transparent and have the technology back up that transparency.
Great, thank you. Diogo, maybe I'd like to come to you actually build on this aspect of trust. I mean, Eli Lilly's recently been in the news for having one of the most popular weight loss drugs on the planet, maybe one of the most popular drugs of all time. And yet at the same time, it's very novel and new. And how do you see this aspect of trust evolving in the medical sphere as we increasingly have access to novel treatments, novel approaches that there isn't necessarily familiarity for? How do we actually ensure that there's sufficient trust in the system as we roll out these new products and services?
The trust is at the core of all of this for medicines. Fortunately, I actually saw that the pharmaceutical industry is rated higher in trust than trust in our governments. So I don't know if that's just a low bar, but at least it's not completely at zero. I'm new to this industry. I joined 3 years ago, and so I still have a little bit of the outsider view. I don't think most of the world that is outside of this industry knows the level of detail that this industry goes into, the scrutiny that goes into a clinical trial to make sure that you've controlled for everything, the scrutiny that goes into the manufacturing process. I thought I had seen manufacturing environments before, but the sterility of these environments is unlike anything else. The biggest risk I think we have for all of us, and it's something for us to work on together, is a loss in that trust. And so things like contaminated medicines, counterfeit product, is a real problem. And in fact, you mentioned our medicines for overweight and obesity. Probably one of the biggest things that I'm concerned about is the arrival of counterfeit products. Because that is going to happen whenever you've got a blockbuster product. I was at Apple before this, and I saw what happens when you have a product that everybody wants. People can even figure out how to make counterfeit iPhones. And I think if people can make something that looks like an iPhone, they can probably make something that looks like a medicine, even if it doesn't act like one. And so maybe I would invite my colleagues here as well, that perhaps it's time for us to do something a little bit different and to really change that game with counterfeit products so that no patient ever gets injured by taking something that was a medicine that was not coming through one of these highly controlled processes.
Great,
So I just wanted to add, because I think you brought in the element of, because a lot of transformative impact to what Greg was saying or to what Ms. Sangeeta was saying is in these interfaces of different companies and organizations coming together, and the technology when it comes to federated learning and federated evaluation and tuning and things like that, right? I think Apple has solved for some of it. Most of the consumer companies have solved for some of these things. I think there is an opportunity for us to actually think about how to use more tech and the machine learning capabilities to actually create an environment where you can actually use data share data without really moving it. The famous face recognition and does my face data go to Apple? When I actually train the model is a question that a lot of us think about, right? Where consumer companies have solved for it, and maybe something that we have to think about as well.
I totally agree. I think there's so much more opportunity for the whole industry to collaborate on things like data, because in the end, who benefits? It's really the patients. We have enough interesting problems. The chemical space is so large that we're always going to have new things to explore and go after. And things like safety are not things that we want to discriminate on. I think we can up the game for the whole industry, and all patients win.
Absolutely.
I think this aspect of trust, data, and also the role of government is actually quite interesting here. India has been a pioneer with the Aadhaar program, with UPI for the payments interface there. I'd be curious, do we see something similar emerging in the domain of healthcare data, something similar to UPI that could give trust in a kind of interoperable system with protocols to share that data among the relevant actors? And just going to open that up, maybe Sangeeta, maybe you could come, and then I'd also be curious to hear from Shriram on that.
Yeah, I think it was very insightful of you to pick up on the trend of digital public goods that India is pioneering. And you are absolutely right that in the financial sector space, something major has happened, but also in the healthcare space. If you look at the first thing, the COVID app which was created, which is now being shared with other countries, enabled our whole country to access where do they go for their vaccine, maintain their record, do a messaging system at the back end that you're due for your second dose. This is something that had never been done at such scale. I think concomitantly what is happening is the entire National Digital Health Mission, and I'm privileged to really be, part of that, is that data is being collated. India did something quite seminal many years ago when, we were on the recommendatory panel, in that we began the standardization of access and storage of data by taking a national license of SNOMED. And therefore, synchronization of data standards is easier once you're moving into an electronic health record because SNOMED access is free. There's more work to be done, but I think the National Digital Health Mission augurs some very exciting opportunities in terms of data sharing, and I'm a great advocate of, confidential computing, but if we can embed that and then create alliances of data sharing as well as data insights and mining. And I also have another, data point which I think is very exciting, is that the IITs and the engineering schools are creating hubs for analysis of this data. So I believe in the next 3 to 5 years, India is going to see an exponential growth in the use of Gen AI in healthcare applications. There's tremendous focus happening on it. There's a lot of push because we need to enhance the effectiveness of our healthcare system. from early diagnosis to optimization of resources and to finally handling and empowering the individual with the knowledge to keep themselves healthy. A combination of this move with, I hope, and Jeff Mata was speaking earlier, I hope we can see more manufacturing in India, more devices in India. The pharma industry has done tremendously with their India base. It's time for biotech to catch up with the medical devices. So a combination of AI, healthcare, resources, because of our demographic profile and the number of medical schools coming together, all these are kind of an ecosystem evolving to enable new insights from India.
Great, thank you. Shreya?
Yeah, so I think data sharing is key to having trust in these AI models because if you look at the population of the world, you have to have representative data from your community, people whose genetics are similar to yours, in order to have reasonable predictions that make sense to you. And no one person has access to data from all over the world. So I think sharing is essential for trust so that these models are predicting representative of what your concerns are. Now, when we, as Microsoft, when we engage with partners in healthcare, one thing we see more and more is the fact that the data is in islands. They are in different data formats. One hospital will have one format, another hospital will have another format. But technology has improved so much now that these things can be interoperable. Right? Particularly with Gen AI, we can actually break across silos and reason across data formats. I think that is definitely possible right now. And but what is important, I think, is that we enable sharing, but sharing in a way that it conforms with policy. That we are very clear about what we are sharing, what we are not sharing, and when we share with confidence and be intentional about it. And technology now provides you the ability to do that. Right? I think that's how I think about it, yeah.
Great, thank you. I'm going to come to Greg next, but I'd also like to see if we have a mic or mics in the room to open up any questions from the audience there. So I think, yeah, we do have mics at the end there. Yeah. So what we'll do is, Greg, while you're answering the question on some of the challenges we see about doing that, if people in the room could raise their hands, then we'll actually try and get mics to some of the folks there, and we'll bring some questions forward there. But Greg, we've heard about the opportunities, the role of the new technology, the role of data, trust. What do you see as some of the challenges to actually unlocking the benefits and opportunities that we've heard here?
In AI specifically, right?
Yeah.
Yeah, I think there's a couple things. One is we talked a little bit about this, is the interoperability of health data. I mean, it's just not something that the industry has needed to do. Hospitals are designed to take care of people in a certain location where one human being comes and talks to another human being and they interact and they try to help one another. It was never really designed that the sum of all of those interactions would ultimately make itself into some big sphere of data that would help everything else. But if you think about that is the opportunity. If you're a physician, Sanjita can tell you this, a neurologist might see in a 35-year career 10,000 patients. But if you think about the power of taking every MRI ever created for a patient with multiple sclerosis or some sort of neurodegenerative disease, an AI model, literally can actually be like a doctor that has seen tens of millions of patients. And if you think about the value that creates, it's great. Now that sounds great on paper, but unfortunately every hospital system has its own little sort of cadre of information that doesn't really interoperate. You have situations, I'll use MRIs as an example. If a hospital here in Hyderabad is using a Siemens MRI machine and another hospital in Bangalore is using a GE system, those two systems have different resolutions, they have different amounts of signals. You can't necessarily build one model based on the heterogeneity of the data. So I think the first part is the heterogeneity of data in healthcare is a huge problem, and it's not obvious how that's going to get fixed because the financial sort of incentives and capital system isn't there to bring that together. Number two is, I think, when you actually can get AI models run, you have to make sure that they're durable across different subpopulations. You know, I mean, even in India, the difference between genetic differences between the north and the south are quite different. But I can't take a model built in either the north or south of India and have it reliably work in Japan. So you really have to start thinking about how do you have some governance where you really understand how these models work at a very, very deep technical level, and make sure that you have built the governance around ensuring that as practitioners, and doctors are not experts in AI, this is not what they do for a living, they have to trust that when a physician is using a tool that says, here's a patient that may have atrial fibrillation, they have to trust that that went through a certain level of rigor, that they're not going to, you know, do something or intervene in a way that's not appropriate. So that really has a lot to come together. So I think those are the two things. It's getting the data to come together to build a durable enough model where it works, and then also having the governance around these models where practitioners and patients can rely on what the output of them are.
Great, thank you. I think I saw a question here. I don't know if we got a mic to you available there at the table. Yeah.
There's one over there.
No, I came here. Hi, Jeremy. Welcome to Hyderabad from WF. And also, we are very proud of Apollo and Sangeeta. We started this much before the evolution of the smartphones, the telemedicines, more than 2 decades ago. The question is a little longer. My name is Chakravarti AVPS. I'm chairman of Federation of Pharma Entrepreneurs for 2 provinces, AP and Telangana. I'm also global ambassador of World Packaging Organization. We've been talks with the WF in Davos recently. The question is, the digital health is the future.
Could you come to your question, please, sir?
Invariably, the digital health is the future. The integration of the augmented reality to put the digital elements into the physical environment. So far, with the AR integration, you can have, with a simple scan, you can know the product, where it is coming. With a 3D virtual assistant, probably a physician, and he can tell you what is the product, when the dosage needs to be taken, what happens, what is the background, everything. That's all there, already there. But in the real time, one of the German techies was speaking to me. He's already experimented. I'm talking about the real time. For example, whichever...
Sir, excuse me, could we come to the question?
Whichever physician
yes.
you choose,
yes.
with a simple scan, with the integration of the augmented reality, the physician would be able to tell you how the medicine to be taken, what he actually suggests you, the physician. It's not the pre-recorded version. It's with the advent of the high bandwidth of the internet, your physician will come onto the line once you scan it. In the real time, he will be doing. Is it going to be commercial? Maybe Sriram can answer or Greg can answer. It is available, but is it going to be available at a mass scale?
Okay, thank you. And if you can pass the mic, we'll take a second question, then we'll answer them together.
Hello, I'm Shalini Akshantala, and I'm founder and CEO of Pharma Informatics from Berlin, Germany. I've traveled here from Germany. So it's really nice to see so much of representation here. And I'm very glad that India is moving forward in the AI area. My question is more on the core topic of the AI when it comes to data integrity. A couple of days back, FDA has expressed its concerns that the data integrity is a persistent issue here in pharma companies and healthcare sector. And as representatives of big hospitals and pharma companies in India, I would really love to know how this data integrity issue would be addressed so that we don't have to be in news that this is a persistent issue in India.
Great, thank you. So I have one on the commercialization on some of these new and emerging technologies, and also this aspect of data integrity, which I think also comes back to this aspect of the interoperability as well, right, when you have these different systems coming together. So I'm going to open it up and see who'd like to jump in on either of these questions.
So
maybe yeah.
I think you start and I'll continue.
Sure.
Go ahead.
So I think on the data integrity, I think we are moving far and fast ahead on this. I don't think it's in places where at least where the investments into digital and where some of these paper systems are not in existence anymore. I don't think that's at least not the kind of observations or kind of issues that we are seeing in the industry. Yes, of course, the industry is a large set of players with different levels of maturity, so I think that continues to be a question that we should certainly answer. But the way some of these are important for the AI systems, so if we really want to move forward in AI, we first, like to what Greg was saying, heterogeneity of data as well as the integrity of data is critical if you're building something on top of it. So it's the first check that we do. When we build the system, you first check whether the data quality and the governance and security access is the core of what we do, and at least we start with that as the baseline before we actually build anything on top of it. So I think we're moving pretty quickly and far out.
I think that was perfectly answered. I just want to highlight on one or two other aspects. Number one is that India is a very vast system with a diverse environment. Our healthcare system has often been described as islands of excellence in an ocean of inadequacy. Now I'm adding one more line to that of possibly disconnected pools of data, which are now beginning to get connected. I also want to say that many organizations understand the importance of patient consent. The new laws on patient confidentiality are quite stringent, and therefore there's a 1-year window where everybody's going into compliance. But the biggest aspect of this is the focus on building, collaborating, and keeping, the universal good in mind. And I think those three are the guiding lights. And after that, you can get over everything else. Data integrity can be done. Just a quick comment on the computing machines. I don't think there's anyone from Siemens, Philips, or GE in this room, but the fact you are perfect. So DICOM standard, I'm sure he wants to talk about that. These machines talk to each other because of DICOM and a standard which was put in place. In our 72 hospitals, 300 clinics, we will have machines from all over, but they all move into a single PACS. That data is de-identified, securely stored, can be used for Gen AI, but is also now available in our mobile app with the PHR. So in the personal health record, you can pull up your record. You can show continuum of care. If you're using Apollo 80% of the time, but you go to one doctor, you can show them your records. You can add those records into this because we believe in some mega trends which are happening. Number one is patient or the healthy individual. You would like that. It's not patient. It's healthy individual is at the center of care. Population health must be our focus because we cannot afford to do purely curative care. We have to understand risk, differential treatment, early diagnosis and prevention. The site of care is changing from the hospital to the clinic to the home to a 24/7 ubiquitous access. And the pace of change is happening faster than you can think. And it's for us to come together and guide that change in the right direction.
Great, thank you. Shriram, and then we'll take another question from the floor.
See, I think one of the very important aspects that one has to take care to get confidence in data integrity is provenance. If you train a model, what data was that model trained on? I mean, if you take a cereal, right? The cereal says, here are all the contents of this cereal box. Or if you go buy anything in the market says actually what. But when you have an AI model, right? The AI model doesn't document itself on what data it has been trained on. The metadata and the provenance has to be stored. That's the only way to get real confidence on data integrity. And as the data is used for multiple things, right, you have to track where the data is, right? With Gen AI, what becomes more complicated is that you may be training models based on data that was generated by a model. So we have to actually watermark what was generated. You need to have track record and provenance of where the data came from. And that it is possible to do that technologically. We have to just imbue that in our processes and so on, so that when you look at a model, the model documents itself on what data it was trained on, where it came from. I think those hygiene things are so important, I think.
Great. Last question from the floor, and then we'll wrap up here.
Actually, majority of my question is answered, but that sparks a beautiful question. We are going and progressing with such a speed. We are adopting to the technology so fast in a regulated industry, right? But that also leaves a lot of blind spots because somebody mentioned about the sterility of this environment, right? We are taking in, and I call AI more of a adaptive intelligence and artificial intelligence. in this world. So when we are adapting to it, there are a lot of blind spots. And each industry, like Dr. Sangeeta has mentioned already about Philips, Siemens, how we anonymize the data and give the information. But there are a lot of other connected cases where Garmin and other industries are coming in where this data is not anonymized and still may get into the wrong hands. So when the data wrangling is there, how we are as an ecosystem ensure the layer of transparency, security is provided over rest of the things. So how do we deal with the blind spots?
I'll say one thing. I think it starts with incentive and intent on what we want to do. If our incentive and intent is clear, much can be done, is what I feel.
I'll second that. I'll just say you can't figure out all the blind spots in advance. They're blind spots after all. And the worst thing that you could do is wait until you think you figured them all out before you try them. When new technologies come along, you don't know what to expect, and trying to put rules in advance is kind of crazy. You know, I don't know about you, but I really could use teleportation. In fact, it would be very helpful to get between meeting and meeting. But teleportation, imagine if we decided we wanted to invent rules and guidelines and transparency and safety around teleportation right now before it comes. It'd be ridiculous. You don't know how it's going to be used. And so the best thing that we can do is to do this and keep going in little steps and making adjustments as we go. In fact, when people ask me what am I the most worried about with AI, the thing I'm most worried about with AI is that people get too scared to use it. That's our big opportunity, is to take little steps, make progress. We're going to make some mistakes. We're going to skin our knee, and we're going to have some accidents along the way, but let's pick it up and keep learning from it as we go.
Yeah, I want to just build too, and I think that companies like Microsoft, I think, have really been leaders, you know, with the FHIR standard and things like that. So I think the rails and the pipes will go. I think it's important to keep the patient in mind. If you're a 35-year-old mother of 3 and you've been diagnosed with multiple sclerosis and you realize that you're going to end up in a wheelchair, the last thing you're thinking about is data security and privacy. You want the healthcare system to get its act together and align to figure out how to come to market with new therapies to create treatment. If you're a 40-year-old father of 2 that has just been diagnosed with lung cancer, this is just not, we kind of get a little bit in our own headspace around the IT stuff here. At the end of the day, this is technology that can make a meaningful difference. The average cancer patient fails in the first 2 to 3 lines of therapy because simply we just do not, physicians and doctors and science, we just do not understand enough about the physiology of the disease. If AI can do this, and we spend all of our time trying to make up rules, to Diego's point, before it's even there, we're not helping patients. And so I think companies like Microsoft and others are doing a great job laying those rails. I think governments can, should, and will develop regulations, but I think patients are waiting. They need these tools, and we gotta kind of get out of our own way a little bit on some of these worries, because if we're so conservative, nothing will ever actually happen.
Well said.
Great, thank you. Now I understand from the organizers we need to wrap up here. So in closing, we've heard how that we have over 1,000 biosciences companies here in the Valley. What is the advice that you would give to them to be able to partner with your respective organizations or to be able to unlock these technologies? What are you looking forward to, and what kind of advice would you give to the entrepreneurs and leaders in the room with us here today? I'm just going to start at the end of the panel here and then walk this direction.
Okay. So I think the biggest thing which I'm seeing is that it's a very famous saying that decades can go by where nothing much happens, and then suddenly there are weeks where a whole decade happens. So the pace of change is happening so fast, and we have a deep commitment to do as much as we can at Apollo, and I know that we can't do it alone. So I just want to say that we are very open for partnership on innovation, for discussions around sharing. We're very committed to remote care, advanced, intensive care, care at home. We believe that this can be transformational, and all kinds of partnership, from device to new AI tools, to the joint creation of biomarkers for early diagnostics. We're open to discussions on all of these. We have a small team called ARI, which is Apollo Research and Innovation, and ARI would be very happy to receive, to engage, and to find ways to work together.
Thank you. Next.
Yeah, I think probably I'll just speak as a representation from the country in that sense. From a pharma perspective, I think our last few waves of innovation and progress have hinged on manufacturing and cost efficiencies and things like that. But as we look to step forward on innovation, I think AI is going to give us that disruptive advantage because we've talked about funding challenges, regulatory and other challenges in the past. But I think with AI, the ability to come up with novel ideas and fast forward the drug development, I think it's a huge space for us. And I would request everybody to kind of partner to what Ms. Nagata was saying, come together and partner to actually find the next best medicine from India. Yes.
So my advice is going to be pretty practical, and it touches on what you said. Is the way we move forward is we need to partner, we need to work together. Not one company, not one can do it all. We need to do it all as an ecosystem, and so let's talk to each other. Let's work together. Let's figure out how we can do great things and really make a difference for the world.
The two pieces of advice I guess I'd have for entrepreneurs is, one is make sure you don't have a solution looking for a problem. I think there's still a lot of companies that aren't really quite clear on what problem they're trying to solve. That tends to be endemic. And then I think number two is try to solve for the whole of the solution. You still have startups that I would sort of say are like features of products rather than actual full products. And the healthcare system is enormously complex. And especially if you're going to ask a doctor to use something, you can't ask them to log into 20 different portals to do 20 different things. So you really have to be willing to take on the end-to-end workflow associated with aspects of this industry, which is not easy to do. And it's one of the reasons why there haven't been a lot of unicorns, in the digital health space. It is a really hard problem to tackle, but you have to look at the holistic part of the problem, not just the piece part.
Thank you, Diogo.
My suggestion to the biotechs here is, well, actually, the worst advice you could probably get is to be another biotech, just one more. We don't need one more biotech company in the world. What we need is different thinking. And I think, here we have a chance to leapfrog and not just do things that are happening in other biotech centers around the world, and perhaps do some things that are truly unique. I would encourage any entrepreneur here to take advantage of what's different about here. The proximity to manufacturing is one great example, and some of the materials that you have. The connection to the services industry is another huge advantage. There are a lot of advantages to really take it to really capitalize on right here. So don't be a global biotech. Be a biotech that's rooted here in the advantages and figure out how to make that unique, and that's what'll be interesting for big organizations like us.
Okay. Triana?
Yeah, so I would say, start with the real problem and have your goal to benefit the health of our communities. If you're clear about that, right, much has been democratized, right? It is easier to now build AI models. It is easier to use a cloud. Much of the technology has been democratized, right? Make sure that you're solving a real problem, providing clear benefits to people, I think, and then work backward from that. That would be the advice I would give you.
Great, thank you. So some of my key takeaways here, the speed of change, how quickly everything is moving. We heard a lot of great positive examples of the benefits this brings forward. The role of people in this is a hybrid aspect where we need the people working with the technology, and we see the technology be able to augment the workforce there. Interoperability and trust in data, integrity there, and making it human-centric. I think that's probably the most important thing. Everything we do and that we're working on ultimately needs to be for the benefit of the patient, for the citizen, and for society. And I think here, we heard earlier, the doctors don't necessarily AI, and the AI specialists don't necessarily understand medicine, but Hyderabad and Telangana might be the place where that's the exception of the rule, and we can see a new generation of doctors, scientists, AI specialists coming out. So thank you, and thank you to BioAsia.
Thank you to our speakers for that wonderful panel discussion. I'd now like to request Mr. Scott Burgett to please do the honors of felicitating our panelists. We'd request the audiences to please be seated. We'll be starting with our next session shortly. We request the front rows to please be seated. We're starting off with our next session. Ladies and gentlemen, we'd like to welcome you to our next panel discussion on unlocking the potential of GCCs from centers of capability to catalysts of global transformation. We're fortunate to have with us a distinguished panel of experts to dive deeper into this discussion. Please put your hands together for Mr. Siva Padmanabhan, MD and Head, Global Innovation and Technology Center, AstraZeneca. Sorry, is Mr. Siva here? Okay, yes. Yes. We'd like to welcome Ms. Mrinal Duggal, Head of Sanofi Global Services. Ms. Vani Kodandaram, Head of IT Culture and Strategy, Bristol Myers Squibb. Mr. Sanjay Vyas, EVP Global SUB Head and Managing Director, India, Parexel. Mr. Madhav Vattikutty, SVP, Calix. And our moderator for the session, Mr. Sunil Venkatesh, Partner Technology Consulting, EY India. We request you all to please give a warm welcome to our panelists.
Okay, yeah. Thank you so much for inviting us to participate in this panel, and I want to say a big thank you to the panelists for turning up today. Thank you very much. So this is an interesting topic for all of us to to discuss today. The impact of captives and how captives are kind of changing over the last couple of years. And Hyderabad is an interesting place to have this conversation, especially since Hyderabad is home to about 250 captives. About 13% of them are in the healthcare and life sciences space. And in fact, in the last 12 months, there have been about 15 or 16 captives that have come to Hyderabad, new captives, and 2 of them are on the stage today. So, it'll be interesting to get your perspectives as well, right? The captive journey has, started with captives being treated as back offices or places where, companies offshored. And over the last, I would say, 15 years, they have migrated and evolved to being places which are driving tech innovation, which are being at the forefront of, driving innovation for their parent organization. And it's really interesting to, talk to someone like Siva, for example, and, I'll dive right in. Siva, you've been, running this captive for 9 years now in Chennai. Can you walk us through, the AstraZeneca journey, how it was when you started and, where you are today?
Yeah, thank you so much. Respectfully, though, I'd first like to describe ourselves as GCCs rather than captives, if that's all right. But we started the Global Capability Center journey in 2014, so 9 years ago. At that time, there were not many in the top 10 biopharma that had GCCs in India, and we were one of the first few. And in that time, what we realized that we were very heavily outsourced, but what was really important was to be able to bring some of these core capabilities in-house, because it's already evident even then that the digital wave was coming, and the technology and the data and the platforms and the products that are based on that is going to become core competency to the company and no longer an adjacency. Just as our molecules are our crown jewels, so are these digital capabilities going to be the crown jewels of the industry. So that's a realization with which we started. And as we progressed, year after year, I think we've just been going up that maturity curve of initially being able to deliver these services from India, but then starting to own end-to-end the capabilities and platforms and products that are established in India. And then in the current wave is around the innovation that goes from east to west. Are we able to bring the technology, the startup ecosystem, and everything that's available here to put together some of those cutting-edge innovations that can be scaled globally? And we already have several examples of this in several of the GCCs in the biopharmaceutical industry coming out of India. So in this evolution also, everything around the GCC ecosystem has also evolved. So in terms of how the governments and the startups look at the GCCs, they totally now realize that the GCC is not equal to a third-party service provider. They come with deep domain expertise. They are able to then coach and help these startups to scale globally, and they also are able to expose some of these businesses in a global sense. So a lot of this has changed, and this also the realization of this with the government is really now giving the kind of support that state governments are providing is just been tremendous. And I think the journey continues. The next 10 years is going to be really crucial to this ecosystem as well, to see whether the GCCs are now able to really look at disrupting themselves and really be able to be agile and close to the business, so that with all of this innovation that's happening, we still stay very relevant and still stay front and center, versus the GCCs that don't do that, which then have the risk of getting marginalized, right? So that's, I think, the journey ahead as well. So just a...
No, that's a great point, Shiva. And in fact, I think the previous panel, both Greg and Diogo spoke quite quite passionately about the kind of impact that their captives are having, right? They're doing, molecule discovery out of here. And, they also spoke about the same point that you made, which is, innovation happening in the East and then going to the West. And the fact that, molecule, discovery is happening here, and then it's going to the wet labs in the US, right? Which is, which kind of portends a really bright future for GCCs in India. I'd like to talk to Sanjay now. Sanjay, you have a different kind of an operating model in the sense that you have a GCC, of course, but you also have significant, India presence, so to speak. So can you walk us through, how the innovation that you're having at the GCC is influenced by your India presence, but also how this is impacting, global operations as you serve your clients?
Absolutely. So first of all, thank you and pleasure to be here with the esteemed panelists out here as well. I think I'll just echo what Siva was just mentioning. I think at some point of time, there was a moment when all these GCCs were looked as a cost arbitrage, but it has gone from a cost arbitrage to a value arbitrage now at this point in time. And I'll give you a few examples, especially from Parexel's perspective, how this has happened, because at the end of the day, there was a time when if 10 FTEs were to be moved from a high-cost country, then they were like, oh, instead of 10, we could have 15 or 20 in India. That was the thought process. But now it's no longer that. It's like, oh, if you replace 10 FTEs, then can you get the same value for those 10 FTEs with similar 10 FTEs in India as well? What we have done is, I'm managing 2 global P&Ls as well, sitting here in India, in addition to being the head of the country as well. So pharmacovigilance and safety services is one example. Like the entire P&L, actually 80% of the population sits here. Even customer-facing roles are actually sitting here. We manage the entire end-to-end safety adverse events, start from the first case intake to all the way to regulatory filing, sitting in this part of the world. The other example is today, it's pretty much Parexel India is like a mini CRO within the global CRO as well. So sitting here, our teams are no longer managing the minuscule or the transactional tasks, because we have now proper physicians on board. We have proper biostatisticians, statistical programmers. We can actually literally write an entire protocol from start to end, and not only write it, but it can execute it from start to end sitting in this part of the world, including monitoring the projects and conducting the whole study and then delivering it to the FDA for the final outcome as well. So those are some of the examples I wanted to bring. So this is where, while we are continuing to develop the shared services, while we have the HR, the finance, the IT components, the contracts piece of it, but if you look out of the 6,100 people that we have developed in India, probably that's like 10 to 15% of it. The rest, the 80% is actually driving the P&L.
Right. No, that's a fantastic observation. And so Bani, Bristol Myers, BMS came to India very recently. And it's interesting that you made the transition from the US, you came here to help set this up, and you have the benefit of having seen or learned from the likes of Siva and Sanjay in terms of what they have done and their journey, right? So how has your journey been over the past 12 months? What are some of your learnings, and if you can talk us through this?
Yeah, no, thank you so much. So I think the first learning is what I'm going to share is we don't call ourselves captive GCC. We are BMS Hyderabad. We are Bristol Myers Squibb Hyderabad. And I think that was an important learning for us, because our office here is no different from an office in Nassau Park or office in Boudray or an office in Chester. So all our employees can very proudly feel they are Bristol Myers Squibb employees. Right. So what I'll do is, before I start, I'll also say we're not completely new to India. We do have a commercialization in Mumbai, and then we have in Bangalore with BBRC, with Syngene, we have a research collaboration which is there for the last 25 years. But a center like this is definitely something new, and there was a lot of learnings. So I'll share my journey in 2 aspects. One is my personal, and then the site journey itself. So Greg Myers, who was here a short while ago, so he's of course our Chief Digital and Technology Officer. So Greg was one of the visionaries who was looking to see, should we open up a center in India? And he said, anybody wants to raise their hand to come here and help? And we always knew we would be hiring local talent. So this was more initially, to get it all started. And I said, raised my hand, and my boss, Pete, at that time said, I have no job, I have no role, do you want to come help set it up? And it was just a beautiful way, and I'll never forget these 3 words. This is how I got my job offer to come to Hyderabad. And I said, this is an opportunity, for us all, the core team, to come and make a difference in the company, where we are actually coming to a country where we have the best talent. And this will enable us to kind of support our patients from everywhere. So it's a beautiful journey, incredible journey. This is where I move over to how we actually even approached it. We did a lot of due diligence. A lot of trips were made to India. Our leadership came to India to learn about what's working and what's not working. And I have to say, just so pleasantly surprised is the word I want to use, is how open everybody in the ecosystem was in sharing their experiences. I mean, we are the new kid on the block, and I remember the first time I met Shiva was in last year, I guess in September sometime, and he was like, hey, Bani, just watch out for this. This works, this doesn't work, this is what we learned, this is how we evolved. And I think that is something that's really unique, I just feel, to India. And Hyderabad, best decision to come to Hyderabad. When we evaluated, of course, where in India we would want to open our center, did settle down in Hyderabad, extremely happy with it. A lot of support from the government of Telangana, a lot of support from Telangana Life Sciences. We had multiple connects with Shakti, not just to understand where we are today, but where the state is going in terms of the support. And yesterday I was very encouraged to hear Babu Garu talking about how we're going to maintain the talent pool coming in. Because as more and more companies come in here, and I think we were just talking about that right before we came in, is how do we not kind of pull from each other, but how do we kind of have that input funnel where we are all in the business, how do we all get the best talent? That's what we are all here for. So I think it's an incredible journey on all counts.
Fantastic. So, Vani, what might also be interesting is to understand a little bit in terms of, did you adopt a different approach to what has been done in the past? Did BMS take an alternative view? And if so, what was this?
Yeah. And I think the alternative view, I think, is very similar to what Shiva said, and I think that's the journey. Like when you look, I think in the Indian category we fall under Global Capability Center, though we don't call ourselves a Global Capability Center. But there's the evolution. You have GCC 1.0, 2.0, and the evolution. So I think we are way up in the evolution, where we're looking at, again, we are here for talent, and you heard Greg before, innovation. This is going to be a core hub of innovation, and building those capabilities. And I think Sanjay said that too, is we're going to be capability building. It's not transactional, or it's not something that we say, hey, you know what, I need a resource. Okay, let me put that resource in India. That's not the idea. The idea is to have self-empowered capabilities built in here that can actually help above market, which is at a global level.
Fantastic. So, Mrinal, similar question towards you, right? Given that, Sanofi also came quite recently to Hyderabad. Can you talk to us a little bit about, first of all, your journey, but also the kinds of things that you're doing in your capability center?
Thanks, Sunil. So, I just wanted to clarify first that we are not new. We are in Hyderabad, I think, from last 5 years almost. And we've been very slow, very silent in building up the talent that we have today at our office.
So apologies on our behalf.
But we announced last year because pre-COVID or during COVID, it was just, no one knew what's happening around across the industry. So that's why we were quite silent there. We did not go the traditional route of building the digital capabilities first. We started with the medical function, commercial functions, R&D, very low-hanging fruits, as we call it. And what we did, or what we made sure, is that this talent or these teams are an integral part of the global teams. So it's not a cut-off, or adding to what Vani said, that these are not two different offices. They are one Sanofi and part of one team overall. So we're doing a variety of stuff here, and now we've started building our digital capabilities as well. It's a large setup that we are creating.
And within that, we have all aspects of digital covered from Hyderabad, because that's what India and Hyderabad is known for. What helped us scale up is the adaptability, the learning agility, and the maturity that the people had, within the site. Also, not just the experienced talent, but also the fresh talent or the graduate pool from the universities and the colleges that we have tie up with. So that helped us bring the talent on board and kind of also developing the talent and retaining it in-house, which we are doing very good at.
Super, thanks, Mrinal. So, Madhav, to you, Mrinal spoke a little bit about, about Sanofi building out digital capabilities. You've built out significant digital capabilities. Can you talk to us a little bit about, how you have embraced digital technologies and what are some of the cool things that, Calix is doing, leveraging digital technology from the captive? I'm not sure that mic works.
Hello?
Yeah.
So I'm going to look away.
You okay? Can we try and get that mic on?
Hello?
Yeah.
Thanks. So no, thanks for the question, Sunil. I think Calix just introduces a company that works in the clinical tech space. So by definition, there's a lot of tech happening, but tech is enabled by process, and process is obviously executed by people. And I think one of the things that we've seen as we've continued to scale is that the scale is happening on the tech side and the people side as well, with more efficient processes. And as we continue to grow, the thing that we've seen is as the tech improves because as we set up these units in India as GCCs, multiple functions come over to India. And as multiple functions are coming over to India, it is possible to see the connections between those different functions and start innovating within those functions, and then through those functions, across those functions. So the ability for us to see that innovation, that whether it's a clinical trials process that is dealing with research of a particular drug, oncology related, or it is dealing with something around the tech part that enables that research, there's a lot of connectivity that is happening across the different functions of a GCC. And for us to be able to apply technology, we've seen really great examples of that, where that connection that exists between the different functions of the GCC has really enabled people to think more broadly and come up with a new technology offering that actually combines those different things. So the innovation is happening within that, the digital transformation is happening within a function through automation, through the use of technology, through the use of new age technology as well, like ChatGPT, Gen AI, and all the data that happens that is captured through the process is also pretty useful in trying to create newer offerings that are optimizing the process itself. So I think as we continue the journey, it is going to be around the innovation is going to come from within the digital transformation within a function, but more importantly around the connectivity that happens between those functions. So we can actually see a broader technology. I think on the previous panel there was a discussion about don't innovate a solution and then define the problem, right? I think what we have the ability to do with so many functions being now a part of our GCC is look across the spectrum and connect all of those and come up with a better technology offering, a better process offering, and a more trained and more capable people organization that helps us solve bigger problems as we continue that journey.
No, that's a great point, Madhav, you make, and the fact that, and this view that you should not think of, that the power of having multiple functions within the captive, and to think about processes, holistically, end to end, is something that can be used to drive digital transformation. That's a great point. So then, Siva, to you, obviously, if somebody is thinking about doing transformation end to end, looking at processes end to end, then, the automatic question is around data and data privacy related. In the earlier session, Greg mentioned that, we should get away from thinking about privacy and, we should think about solving real customer problems and, get out of our way. So that is one way of thinking about it. The traditional view has been, sending data to India may cause risks associated with privacy. What are your thoughts around this?
Yeah, I think that's a really good question, and that's one where I think it's a real test of the GCC model. Is today GCCs are being called upon to do business critical things very fast. So, for example, AstraZeneca's GCC during the pandemic, and when we were discovering, and developing and launching medicines, we were called upon to accelerate that process, right? So, and similarly, there are other examples in the last panel about in silico models, how quickly we can build those. Right. So we're going to be called upon for speed. And there is always an attitude in India that we win, right? We play to win and we deliver quickly and so on. So it's very often easy to forget, some of the important aspects of security and privacy, and that is one of the reasons why this is a very particularly important topic in setting up and also in growing the GCCs, right? So of course, at a global level, you need to have a very robust information and data security governance framework, the risk identification, the policies, the controls, and all of that, and that is absolutely key. But in there is a very important aspect of the data security or information security posture that you take, right? Each company decides what's the right balance between driving for those business benefits and making sure, that the controls are in place to compensate. And that posture is something that's very important to instill in the same way inside the GCC, right? Just as we have globally. Globally, that's been developed over decades probably. Right. For these companies, right? And now here, you're trying to instill that in just a matter of years or months or years, right? So that's a very difficult thing. And so some of the things we have done is to make sure that there are champions, that there are data security, information security, and privacy champions that are actually embedded in every team. So it's about how do you build that culture within the GCC, right? And that means that there needs to be a speak-up culture when both for speed and for control, and the ability for those views to come to the table so that we can find out what's right. And when people badge in every day at work, for them to understand that they're ambassadors now of the company. And the mindset is shifting from what you would do at home or with friends to something that you would do at work, right? So that's really important. So the creation of these champions, and for example, the other practice that we also do is every meeting we start with what we call a sustainability moment. Every leadership meeting, every leadership -1 meeting. And the sustainability is about how do you make this GCC last forever, right? And be successful in the long run. And that includes things like safety, something very simple like physical safety, right? It also includes information and data security and privacy. It includes compliance. It includes things like environmental sustainability, which we can all be part of. So the meaning of this is that we call to attention at every possible opportunity the importance of data security, privacy. Has anything been happening in your teams that could be of interest to others? So just prompting that is very important as well. So a lot of these things we can do to build that culture. So that's really important in the GCC context to be successful in the long run.
Thank you. And Siva, it's a really great point that you make about building the right culture around security and privacy. But at the same time, there is this fact that, we would be remiss not to talk about the elephant in the room, which is, generative AI and the impact that it is going to have on captives, right? Especially from a data and data privacy perspective. And a lot of the benefits associated with generative AI will accrue from, using data that is available with you, right? How do you think we should balance this tension that exists between, the benefits that accrue from, from tools like generative AI, and at the same time, the intellectual property that you have and data privacy concerns associated with that. Do you have any thoughts on this?
Yeah, so that's another very interesting area. So I would not put everything in one bucket, because there are plenty of use cases and examples of how GCCs can disrupt themselves, the work that they do using these tools such as Gen AI, which doesn't really involve a huge risk in terms of patient data or clinical data or anything. It could just be how I deliver the service today, or how I build the product, how I write my software. Of course, everything needs to be looked at the risk lens, but there are a category of things that you can move fast, right, and drive very hard, and that is very important for the GCC to do, because if they don't do that, then you would get disrupted by somebody else. Rather disrupt ourselves than we get disrupted, right? Because today it's possible for someone sitting in Sweden or the US or anywhere to actually assemble a very small team and use a set of tools to do a lot of things very efficiently and quickly at the similar cost, right, cost point. So we have to be ahead of that change. We have to be there before and offering a similar speed and similar effectiveness to that. And also the third-party service providers who have a lot of assets at their disposal, they are investing big time. So, we have to be ahead of the curve as a GCC. And we have a lot of things going for us. The deep knowledge of the company, the domain, the relationships, and so on. So use that to disrupt. And then there's another track which needs to be much more we need to proceed much more cautiously, which is where the data security and privacy are paramount, right? Those use cases where there is IP involved, where there is a patient impact, where there is a regulator impact, and so on. And there, again, I think it's the answer is not to freeze, but to be careful, right? And to do the right level of governance, the right level of evaluation, making sure we have the right posture that everyone buys off on, and then we proceed with caution in that area. So I think it's a two-speed kind of thing that we need to adopt there.
No, fantastic. So, given that we've spoken about Gen AI, it's important that we then address the other part of this story, which is around talent, right? And, we'll talk about Gen AI's impact on talent a little later. But, Mrinal, what will be useful to understand is, how are you addressing the evolving, talent needs within your organization? What are some interesting things that you have done as you have accelerated the growth at Sanofi?
Thanks, Sunil. So, in fact, just to add one point there to the Gen AI, I mean, the people that we have, at least at Sanofi, they're so super enthusiastic about Gen AI. And using and creating some use cases with that I don't see any challenge of kind of explaining that this will create more jobs or this will impact the jobs or not impact the jobs. But people themselves are so into that, and they want to talk about it, and especially the work that we're doing here with the creative and the writing work. We are already sort of into a couple of cases for Gen AI. Now, having said that about the talent, I think it's a mixed fold. One of the things that we've done here, and I think it's unique to Sanofi GCC, is that we've built the entire leadership from within the organization. So most of our, in fact, all of our senior leaders are from within the organization. They've gone through different development programs. The scale of growth within the GCC was quite helpful to do this for us, and also, again, I'm going back to the word enthusiasm of the people to do different things actually helped us doing this. And at all levels of leadership, this has happened. So now this was about the leadership, but also for the new talent, we've developed programs which are 6 months or 8 months program to focus on a particular capability that we need. And we are hiring fresh graduates, then putting them through that program and ensuring there are tests and different kind of assessments that happen to see them where they are right now. So these two things is something that has helped us kind of make the availability of talent from a different source rather than just focusing on the the other similar organizations around. So
No, that's very interesting, Mrinal. And Sanjay, we spoke a little bit about this. You kind of mentioned about some cool things that you are doing, in Chandigarh with universities. Can you talk to us about, how you are helping build the next stage of talent?
Absolutely. Before I answer that question, just one more comment to what Siva just mentioned on the Gen AI piece, because that's a very interesting one.
We should.
So what we adopted, I think the best way to look at it for GCCs out here in India is to, there are three buckets that we have trying to apply the large language modules from an implement and leverage that at a global level. The first bucket is anything that has search and retrieve kind of a concept, where we can make life easier for our people to do that. So that's one area we are implementing Gen AI. The second area is anything to do with content generation. So if there are potential opportunities of applicability of large language modules in medical writing, DSU or safety reports to be created, the first draft, how can that be created by the Gen AI? So that's another experiment that we're doing sitting out here. The third bucket that we're looking at is the workflow automation. So that's the combination. The three, we have very clearly debunked that these are the three buckets that probably has the biggest impact. We have implemented that already, the search and retrieve and the workflow automation or quality documents and the SOPs piece of it. It has delivered significant efficiencies in the range of 35 to 55%. And that's what we are replicating now at a global level as well. Now, having said that, coming back to the talent.
Sanjay, but I would request that, maybe this is a good point to talk to, both Vani as well as Madhav as well to get their perspective on Gen AI before we come back to talent development.
Okay.
Since there's quite a bit of excitement around this topic, right? So Vani, how are you guys, approaching Gen AI? And given that, you're relatively newer, and by the time you launched, actually, Gen AI was almost, you would say, mainstream, especially in the labs, right? It was mainstream in the labs, if there is something like this. So how have you approached it?
So innovation has always been a core part of what we do in our company. So I think when I look at a Hyderabad site, it's an extension. So we had already, Greg Myers was here before, and I think Greg gave some very good examples of how we are playing in the space of AI. And I mean, it's been my prior role, I did quite a bit of digital health where we went and evaluated, what other companies are offering, and we do have some efforts for the discovery in AI. So I think it's been going on, but of course recently we've really picked up on it, with Gen AI, ChatGPT, and even though Hyderabad is new, I have to say this, we've already started delivering on using aspects of Gen AI.
That's fantastic.
And I think one of the things is, how do you simplify protocol writing? I mean, it's an example. Right. So I think it's something that we've already established, and in our new center, we'll continue to kind of grow that.
Right. Madhav, since you are very tech-focused.
Yeah, no, thank you, because if you hadn't come to me, I would have taken the question anyway.
No, I can imagine. Yeah. Gen AI is like setting the cat among the pigeons, right?
Yeah, and absolutely.
Everybody wants to talk about it.
No, I think it's really interesting, because in the context specifically of GCC, our topic today, the engineering ability of Gen AI to basically write code, to do test cases, to do test automation, all of those things are one aspect of Gen AI which I think are immediately relevant to the GCCs in terms of the automation that can be done, as well as the efficiency and the acceleration that can be provided by it. The other aspect of Gen AI is really, I think, what Sanjay talked about quite eloquently about. In our processes, we do a lot of document or evidence generation. We are a regulated industry, so evidence generation is almost central to our existence, right, because you have to prove that you did something, right? So a lot of the evidence that gets generated through our process is something that I think Gen AI is already helping quite a few functions, I would say tasks and functions, in being able to automate those things. And finally, in terms of application to product, I would go the reverse direction of what Vani mentioned, because in our field, what we have to do is, given a protocol, we have to now configure the clinical tools to be able to set up the visit schedule, set up the different aspects of a clinical trial, set up the IP, set up the comparator in our IRT systems and our medical imaging systems. And for us, that is a lot of manual human labor to interpret the protocol. And if we can get acceleration, and there are some advanced prototypes that we built, if we can get acceleration from reading the protocol and being able to at least partly or more comprehensively configure our tools so that they're able to accelerate the configuration aspect of it and make it a little bit more deterministic, means we cut down on the validation aspect, which now has a direct impact on our ability to deliver faster, as well as the cost that we can deliver in. So I think a lot of those applications are things we're looking at very actively. So I think Gen AI is definitely something that is going to be transformational. And I know everyone on this stage and in this audience is doing something actively to enhance, to really harness it in a regulated, validated way that we need to.
No, that's a great point, Madhav. In fact, some time back we did a study and we interviewed, about 500 key executives in the country. And our response rate was 100% everybody's doing something, right? Either it was in the lab or, it was, early POCs, somebody's developing MVPs, and some people are already in the market with their product. But you're absolutely right. Sorry, Sanjay, I interrupted you earlier, but, to come back to you.
That's an interesting one. But coming back to the talent piece of it, I think there's something which is a challenge which all of us sitting out here and many of the people in the audience continue to face, right? The good part is India has a huge potential of churning out the largest number of pharmacy graduates, largest number of physicians in the world, right? But one thing we realized 3 years back when I came back on the ground here in India is the fact that what the universities were churning out as graduates was not really fitting straight out into the requirements of the industry. So one thing we came up was, so we had a Parexel Academy running in Berlin and in US. So we said, why not we tie up with a university at this point of time? And we went to we didn't want to go to a tier 1. We wanted to go to a tier 2 city university because that's where we find, I think it's the Tata model, I would say, which they do pretty well. And that's what we saw. It was one of the case studies that I saw it in Harvard where they were implemented, and they said that most of these tier 2 university students are pretty hungry to learn new aspects of it. And we actually created a postgraduate degree with Chitkara University jointly, which had 120 hours of practical lab. So not only they had the professors, so we designed the curriculum together. We said what aspects of talent we wanted. So we created an actual practical labs for how to write a medical protocol, how to look at an adverse event, how to evaluate the safety processes piece of it, how to look at clinical supply chain and logistics piece of it, which normally these graduates were never learned about this in a practical aspect. And and not only that, but we have people from our organization go and conduct those practical labs in real scenarios in the college as a part of the session as well. So we started this around 4 years back. We started with the first experiment of 25 students. It has gone down to 150 plus students now every year. And not only that, but they spend 6 months of internship with us. And then if they pass through the internship and they clear the final exams, and they even get the first right of refusal to join our organization. And anything that the people who don't get jobs with Parexel, they're actually available for the industry as well to pick it up and then deploy those talents. So that is some of the unique practice that we have developed. We are looking at South and West as well universities right now to do the same deployment and the same model to be deployed very soon.
No, Sanjay, I'm not sure if there are any university folks here, but if they were, I'm sure you would have been mobbed off stage. But that said, it's something which is really important for, captives in general to consider, right? I mean, there's been long perception that captives only look at, I would say, mid-career executives or, experienced hires. And there is a need for captives to contribute towards building out talent. And so this is a great story.
I would like to give one more example. When COVID happened, we had the biggest challenge in terms of clinical monitors in US and in Europe. We actually shipped clinical monitors from India to go and conduct clinical monitoring visits for 6 months, and then they came back here because of the experience and the talent that we have had here.
Right. No, that's fantastic, and it's something which everyone can learn from, right? It's a great story. So, Vani, just last couple of questions. Just to talk a little bit about, you mentioned, when we were speaking a little earlier, you mentioned that you're heading back to the US now and you've taken on a new role. Can you talk to us a little bit about the thinking that was there when you chose to come to India? and what the impact of the fact that you are an experienced executive in the US within BMS, you come here, set this up, and then go back. What impact does this have for the captive?
Well, thank you for that question. So this week actually is a very significant week in many ways. So Monday, we had our new site inauguration. Our CEO, Chris Berner, and the Honorable Industries Minister was there. And followed with Tuesday, we had the keynote from Chris here. So it's, for me, it's like the perfect week. And then I'm on the panel today sharing my story. And on Friday, I finish up my assignment here. So I came here on an 18-month assignment, but I'm finishing up in 10 months because we've done tremendously well. Last BioAsia is when we announced we're coming to Hyderabad. And this BioAsia, we have more than 800 people moved into our permanent location in International Tech Park.
Oh, that's remarkable.
So it's really, thank you. It's a wonderful testimony to how the organization, BMS as an organization, came together. Because we needed a lot of support from our global organizations, and I think that's one of the lessons we had learned is having that support from the global organization. And personally for me, I've been at Bristol Myers Squibb for 27 years now. So last year was when I raised my hand, it was more than 25 years that I was in the company. And it was very significant for me as a woman leader. I wanted to be visible and also come back to my home country where I could actually make a difference. So that kind of intrigued me. The other thing I have to share is I'm a proponent of STEM. I've implemented STEM programs. I mentor individuals. And for me, it's also I wanted to walk the talk. And what I'm hoping, and I really wanted to, it was a really tough week for me, but I did want to be on the panel because I'm hoping I helped pave the way for many, especially women, to say, hey, yes, I can take things that I've never opened up centers, and I came here to help open up a center. So it's something that I'd never done before. So I think it's to be courageous and to make those courageous decisions, I think is very important. So that's one of the messages I did want to give. And I think this is also the culture that I wanted to infuse into our site here. We, as I said, we grew so fast, and it was really had to see how do we keep the employees engaged, how do we bring employees from the different cultures and integrate them into the BMS culture. So that was a big part of the role that I played, because being at Bristol Myers Squibb for so long, I know our company in and out. I know, our core values, how do we work with each other, how do we show up at work. And it's just such a great opportunity that I was able to bring that here and infuse that into the center. So I always tell the team now we have 800 Bristol Myers Squibb cultural ambassadors who can actually take it forward and onboard the next 800 who are going to come in here.
Well, that's a great point, Mani, you make, and the fact that you are able to build that connection between the organization and the culture that exists in the US and other parts of the world, and bringing that same culture and creating that same environment here in Hyderabad goes a long way in terms of ensuring that the captive, as Shiva mentioned, is enduring, right, and remains here for forever in that sense. So Madhav, we have a few minutes to speak and last comments from you, specifically around this whole enduring bit, right? What do you think captives should be doing as they seek to be enduring on a go-forward basis?
I think first, just a note to what Mani said. I think it is important to acknowledge that maybe so far, at least of all the panels I've seen, this is the most gender diverse panel. So
I think we should say thank you to BioAsia.
Yeah, thank you to BioAsia. Should acknowledge that. But I think in terms of durability and how the evolution has to be constant, and I think it's an easy it's very easy to cliche that, saying evolution and constant is change is the only constant and all of those things. But I think as we see the organization, as we see things evolve around us, it is really important to stay in the context of where we're going and also take charge. I think GCCs, like Sanjay started off, right, were set up with a very specific purpose. Automate, accelerate, solve, but only for a part of the problem. I think as we look at this broader, our influence to be able to impact a broader section of the problem is really something that we have the ability to do. And so to start taking the driver's seat on a lot of those discussions, a lot of those initiatives, is really something how we continue to maintain not just our relevance, but increase our influence in terms of being able to impact the parent organization. The other thing to notice here is a lot of everyone in this panel has a global role. And I think that is very important because as a part of being, as a part of an organization that is working to create this capability center, it is front and center as a strategy and not as a side project to optimize something or to make something cheaper. So I think that is already acknowledged, and I think it's upon us to do it. And I think as I continue to look at this, and this is a thought that happened that I had yesterday after listening to some of these science talks, which is really fascinating. I think as we continue to evolve, I think our GCC, the tech, the IT, the GCCs around that is something that is already maturing, and we know how to innovate, we know how to drive. What is evolving around us is the science GCCs. And I think as we continue to evolve those with the right regulatory support and with the right kind of discussions around IP and how we continue that discussion forward, I think you come to a point in the future, not very far, which says you have the science GCCs, the manufacturing GCCs, and the tech GCCs, and now you have a pharma company in a box, right? So the ability to be able to connect continues to keep us relevant, and I think that's what increases the durability. So we cannot be who we are today, and that's how we maintain our relevance, and that's how we maintain the influence that we need to have on a global scale.
Madhav, I think you've really well articulated, a vision for the future of GCCs. Especially this, this pharmaco in a box seems like, an aspiration which, all of us should think about. And there are already some really cool examples that were mentioned in the previous panel, about molecule discovery and drug discovery that is happening in silico, in the captives, and then, we are shipping this back to the US. I think some fantastic stories to be learned. Unfortunately, I've been told by the organizers that we don't have any more time. And also, seems like this panel is sitting between lunch and everything else. So on that note, we'd like to conclude. But thank you so much for listening to us.
Thank you.
Thank you to our speakers for sharing their insights on this timely topic. Can we please put our hands together for them? I'd also like to request Mr. Ajit Rangnikar, Chief Innovation Officer, Government of Telangana, to please come on stage and felicitate our speakers. We'll now be breaking for lunch and be back in the plenary at 2:30 for an exciting panel on medtech innovation. Thank you, and we look forward to seeing you for our next session.
Absolutely, yes. So I think the talent is there. We need to make sure that the infrastructure is in place, and if the appropriate incentives are there and the controls are not onerous, I think this will flourish. I think those are the limiting factors that have not caused it to go further.
And that's a fair point, but I'd like to go back to the challenge that Gagandeep put on the table right at the beginning. We have a huge need in the area of tuberculosis. Technologies are already available. All we need is to get it to a price point where we can drive access. And, we've done this. I mean, India is a low-cost manufacturing site for many, many things, right? I mean, if I look at the cost of mobile services, I mean, for me, everywhere I go in the world, I always have Indian roaming service because it's the cheapest on earth, right, compared to anywhere else. So the question is, we have the ability to innovate at different price points, but for whatever reason in the area of tuberculosis, that Gagandeep brought up, it's not happened. And you said, Rajiv, that give the businessmen or people a chance to make money and they will, but apparently it's not happening in areas like this. So I don't know, Gagandeep, if you have a point of view on that.
Sure. So what I've heard from the panel is out of our 1.4 billion people, let's serve the top 300 million that actually pay for the devices and potentially IVDs that we use. What about the 1 billion people that have a problem actually accessing care? Now, we've developed a truly outstanding tertiary care model. Excellent hospitals, excellent doctors, excellent laboratory services, some of the best chains in the world, providing services to people who can afford to pay. For the people who access government services, we don't innovate because I think many companies look at government and say, this is completely unpredictable. I don't know whether I'm going to be able to have a market tomorrow. So why would I make a product if I don't know that I'm going to be able to sell it? The Stanford India Biodesign, THSTI, the IITs, the ICERs recognize the problem, they innovate up to a point, they get to proof of concept, and then they have difficulty making a business model out of what they are trying to do. So somewhere we've lost the plot when it comes to serving all of the country.
So I'd like to build on that and going back to some comments made earlier. The scale of the issues facing a country like India is enormous. And there are access challenges, funding challenges, and so on. So a couple of people already talked about this. So the question is, how can digital technologies, including AI perhaps, accelerate the progress of the industry so we can provide more access? Because I think we're not going to keep training more and more doctors. We're not going to keep building a hospital for everybody. So how can we leverage that? So are there ideas that you have, and maybe Mani, since you do a lot of the technology development, maybe you want to start with this. So where are the areas that you think can accelerate the most?
Definitely. So I think there's a clear recognition to Gagandeep's point in that a lot of the discussions that we're having are primarily focused on a particular segment of the population. And I think as the digital aspects become common, right? So now the number of folks who have cell phones across all of India has definitely gone up. So the potential to use those kinds of platforms for those purposes is still there, but you still do not get to 50% of the population. So that challenge definitely exists. So now, knowing that constraint, if I take where data and AI I see as having an impact over the next let's say, a decade or so, we definitely have the talent, right? So in India, that talent absolutely exists. So as I think about areas that we have tended to focus on, so you heard about the colonoscopies and the ability to train AI models based on all the data that currently exists and making sure that the training happens on data with patients to ensure appropriate health equity for patients, let's say, from India, to make sure that that helps inform the ability to detect polyps on a very regular basis. Similarly, we're looking at patients who have pacemakers or other sensors in them, the ability to send data to the patients, from the patients to the hospitals, to the doctors, so they can effectively make clinical decisions in a manner that is less onerous on the patients. So I think data has an impact on many, many different areas, and I think AI is going to have a significant impact on how healthcare is practiced over the next decade, and that'll be true across the world.
You know, I thought some of the examples that were shared this morning of the technologies and the use of AI, and the Medtronic examples were very powerful. However, I, with due respect, say, is that really appropriate and relevant for India at this stage? So that perhaps, Probir, you know, given that you actually operate in these markets, how would you leverage those technologies potentially? Because what Mani talked about and what was presented are really in some ways the future for the whole world. But where can India get started, you think, given the points that Mani made? We have tremendous digital penetration, we have low-cost mobile access, and we've got software capabilities second to none, I would argue. So where do you see that applying from a practical perspective?
So, Probir, before you go, just if I would make a comment. So I think the one thing that we have to keep in mind is, even though some of these things seem like they are for the developed markets, the thing you have to keep in mind is the population of India where all of this applies is greater than the population of almost every other country in the world. I think that's an important piece to keep in mind. But I think your point's a fair point.
You know, there are a couple of cuts, yeah? So you did say that the technology that Geoff talked about this morning, maybe they apply, they're getting developed in developed markets. They're not developed market problems. A polyp in the intestine is a problem everywhere, right? So in a way, and I'm being very forthright, you know, in a way we have created this whole thing about what is Indian and what is global. Medical problems are medical problems everywhere. I think Dr. Reddy works with his colleagues in US, Europe, China, Japan, seamlessly. In the industry, we seem to have created this divide of domestic, multinational nonsense. It makes no sense. So in a way, I think it would help if we move away from the rhetoric and come to a strategy of saying, fair enough, here is what Geoff is talking about. How do we use, now any medical technology anywhere in the world, the adoption route is not a technology company. Yep. It is the physician, right? So, and 90% of all medical technology in the world was actually physician developed, correct? So that's the reason as to why I put that much emphasis on this whole engineering connect, medical engineering connect. It breaks my heart to see that while we are processing the largest number of patients in the world, we are not generating technology. We could, we are not. So fair enough, we are not. But what we could potentially do is to now talk to Geoff Martha and say, where can I house this? You know, where can I find you 10,000 patients enrolled in a month, right? That's the approach. That's the whole strategic approach, rather than taking this whole rhetoric of saying...
Leverage the strength of the numbers that we have.
Absolutely.
And use that as a
Absolutely.
strength. But if I turn the discussion...
Just 30 seconds more, or maybe a minute more. To Gagandeep's point, it's a, you know,
I have done tuberculosis in my past with Becton Dickinson, or HIV, when, you know, in 2001, 2002, India was doing 35,000 ARTs, right? Comes in, you know, multilateral agencies, comes in 2 or 3, a technology company and a pharma company. Look at how many antiretroviral therapies do we do? So somewhere somebody needs to broker volumes. That's not happening. There needs an underwriter. There is an underwriter requirement who comes and says that I will procure 10 million tests, right? At a certain price. Come deliver it to me. If access is not created, I'll still pay you for 10,000 tests. Because at the end of the day, the technology company has to respond to its investors.
Sure, yeah. So if I just go back though to the idea of deploying technology and possibly AI, etc., maybe Sarah, from your perspective, from a regulatory perspective, I know the US FDA has a lot more experience now, developed approving software as a device and so on and so forth. Can you share some things that you think we should be thinking about as we go in this direction for India?
Yeah, I can speak a little bit about what FDA has in place, and I think one of the things I love about working for the agency is that we use science in making our decisions, and so as science evolves, our decisions can evolve as well, and so that's why we're always looking to gather input from relevant stakeholders in our guidance making, in the rulemaking that happens. We have guidance that's out particular to software as a medical device, and I think it will surprise most people in this room that we have over 700 devices that have been approved that incorporate AI or machine learning. So I think that really speaks to the level of review that's been happening and the decisions I've been able to make. Some of these devices actually have filed change requests already. So as you think about machine learning, right, you don't want to have to file a new application every time you've taken learnings and incorporate that into new products. So you can actually file, the agency has ways now that you can file your predetermined change plan for machine learning, and so really you can have a device that's, you know, operable now, and then also taking into those future iterations. So I think, and we've also established a digital health center of excellence. FDA is very transparent in the way that we regulate products, and so the CDRH website is actually very elegant in the fact that you can go there, you can put in determining whether your product's a medical device. Believe it or not, that's actually hard for some of us in the agency as well to figure out exactly what's a medical device and what's not a medical device. So we actually have really great resources. You can actually get decisions on your device. You can get feedback from the agency. You can engage with the agency early on. You know, from the business perspective, I think that's really valuable because you don't want to chase down a road that's potentially, you know, not in coordination with the regulations. So those are some of the areas that the agency is working on and recognizing the power of AI and machine learning and how that's going to transform in the future.
Dr. Reddy, you wanted to add something?
No, just to continue in that point, very important point you made about digital health AI, how India can leverage this very quickly without going to all these high-tech medicines. A simple example is what is happening in diabetics. In the field of diabetes, about 10 to 15% of Indians are diabetics, you know, which is a huge population. Another 10 to 15% are pre-diabetics, which is 30% of the population. Now, there are now several consumer devices, wearable devices, cell phones, where you can have AI apps, and many companies are doing simple apps, because we know that a significant percentage of these patients can be controlled by lifestyle changes. So these apps and AI, now many companies are coming in India which are utilizing this to regulate continuously people who have this type of, at a very low cost, reaching into villages and so on. And there is now data to suggest that they're making a significant impact. So this is also one of the areas that we should focus on, which doesn't involve very high tech, or it doesn't involve too much of cost in that. Yeah.
So it's about access through low cost interventions, but giving the patients the power to manage their own situation. Rajiv, do you have examples where you think the use of technology and AI can really make a big difference in the short to medium term?
Yeah, still very early days, but we saw I would say, especially during COVID times, imaging, X-rays, MRI, CT scan, AI started becoming a driver, number one. Number two, in the area of point-of-care diagnostics, in the area of IVD diagnostics, ophthalmology. Here in the exhibition, you've got fantastic examples of AI being deployed in terms of wearables and being used for telemedicine. Still early days, but yes, very exciting times. I feel like I'm in the dinosaur area. I'm not able to understand most of this because I'm from the consumable side. But yes, I can see the diagnostics and the electronics is going to be a jump start, going to take place. In India, we can see we are a very diverse country, so we've got the bullock cart and the space mission at the same time, and both coexist. And we're going to see it also in medical technologies, coexisting.
You know, I mean, we are, as medical technology folks, we are oftentimes kind of thinking about how do we make AI make our products work better. You know, that's one. But I think there is a huge opportunity, like I said, this thing that we are trying to do, you know, a patient goes back after angioplasty and you are managing, you are helping the doctor manage the patient through an AI chatbot. It's a very simple interface, right? It is a very simple interface which picks up from the hospital's discharge summary and helps the chatbot manage the patient till obviously it requires manual intervention. Yeah? So those are areas where I think not just a product interface, but how the product applies, how post-procedure care happens, you know, all of that. How we monetize that, how we productize that, all that we will figure out. You know, of course, we are many of us are product companies, and we will have to find a connection between the product and the service. But I think there is a huge amount of opportunity we can unlock infrastructure by keeping patients heal faster.
You want to say something, Gagandeep? Sorry.
So I wanted to give some practical examples of what Indian companies are doing with AI approaches. So one, of course, that most people might be familiar with is Cure.ai, which is really doing an excellent job of rolling out their product, multiple products now, but you know, chest X-ray reading, I'll give you the example of my hospital, CMC, where we have so many chest X-rays that the radiologist said, we are not reading chest X-rays anymore because it's just too much work. When you have 1,600 X-rays being taken every day, they focus their efforts on reporting elsewhere. So now with Cure.ai, at least you get a report that is generated on every X-ray that is being done. And of course, they are working with multiple public health programs. I'd like to give you two other examples. Sickle cell diagnostics, big problem in tribal areas in India, big problem in Africa. And a scientist at IISc developed an optical technology for looking at misshapen RBCs that employs AI. And that seems to have dropped the cost of testing to make it actually feasible for us to use this for screening. The third example is an MIT returned engineer with a company in Bangalore that is using shape-encoded sensors and AI to be able to detect up to 26 different analytes in a single finger prick sample. So I don't think we need to stay simple. We have potential. The problem will always come back to volumes and business models.
You know, the example you gave of Cure.ai, I know them quite well. And not only are they reading these X-rays, but they have now, with the data and the AI algorithms they have, they're able to identify potential lung cancer cases much earlier. So they've got a huge program with the NHS, for example, and many other parts of the world where they're screening, just looking at an X-ray which is for tuberculosis, they're finding things that will lead to early screening and treatment, etc. So, you know, the opportunity to start and then progress is quite phenomenal. I want to switch, being a little bit conscious of time and hopefully allowing the audience to participate. If I can ask each of you to perhaps take a minute or a minute and a half to share your thoughts on, can India, the medical technology industry in India, play a significant global role as we solve some of these problems that are relevant for us? Is there an opportunity to play a more global role? So maybe I'll just go in this sequence here.
Sure.
And,
Perfect.
yeah, so that I don't have to keep.
So I think the answer is absolutely yes. So I'll just take an example of what we're going through in Medtronic. So we have a center here in Hyderabad with over 1,000 people at this point in time, and they're all focused on innovation. So this is not back office work, it's all innovation, R&D activities that are happening. And we have folks here who are working on many of the cutting edge technologies that are happening across the world, and many of the new things that are coming out or will be coming out in the next 3 to 5 years are being developed by engineers who are based here in Hyderabad. So there's an enormous impact that the Indian ecosystem can have. And the number one is the innovate in India, design in India aspect. And I think that is an absolutely underpenetrated area across healthcare. And it's an enormous role that India can play in making a change there.
Thank you. Ruby?
There are two things that I would say. Number one, Indian company, if we start in India, we're going to succeed in India, right? We can't say, my company was started in Japan 103 years ago, not with the intention of being successful in India. They had to first succeed in Japan and then be successful in India. So that clarity needs to be there. That said, I think there is a whole lot of opportunity today with this very large, today, see, Medtronic is, if not the one, perhaps the second, number one or number two medtech company in the world, and the CEO is standing on stage here. So there is a whole lot of interest in India by global companies. I think what would help is to have Team India into global boards and say, what can we solve for you? That would be really beneficial. Saying that I can do 1, 2, 3, 4, 5, can I solve this for you? Right? That dialogue will create the ecosystem that we need. Right? Otherwise, we are all sort of duplicating stuff.
Very interesting. Gagandeep?
So framing, currently we are importing whatever number you put on it. 60%, 80% depends on the product. Why are we importing them? Because we think the quality is better with the imported product. What gets manufactured in India frequently is something that you cannot always rely on. So I think in India, rather than focusing on the lowest price point, if we focused on improving quality, I think we would capture markets not only in India but around the world. I've never seen an Indian product that is more expensive than a product that comes from outside India.
Fantastic.
Yeah, good point.
I agree with Gagandeep. I think basically we will eventually be global, but I think first it should be India for India and then India for the world. Yeah.
Dr. McMillan, I think your point about quality...
I can speak to the India for the world part. And I think really, if we look at the pharma industry and the role that the pharma industry has played in the global market, I think some of the things that I would encourage would be making sure that there's proactive quality systems that incorporate GMPs and quality by design. And then also for products that require clinical trials, adhering to the tenets of good clinical practices and ensuring the integrity of data that's presented for regulatory decisions.
Yeah, and actually I'm far away from being a farmer expert, so therefore I don't know, and I would like to understand what were the key success factors of farmer to become so successful with 90% and more penetration to the Indian market, and then learn, and then what I understand is like biotech and formulation, that was the assets the whole pharma industry in India was building on. So now comparing what does that mean for medtech, what are assets we have here, right? It's like IT, AI, big data. So I would say if we, and as I said in my first comment, I'm still a strong believer that smart devices, medical devices, will be the future. Probably almost every medical device will be smart in the future. So use this asset of IT infrastructure, hundreds of thousands of talents, and on top also use, we have 1.6, 1.7 billion capita here, and we have lifestyle diseases which are approaching. So generating data that can help to train AI algorithms here in India and then deploy this globally could be one of those assets which ignites a spark like it was in pharma.
Thank you. I've been given the time warning already, so Rajiv, if you can.
Yeah, I'll try to be
wrap us
brief.
up.
India imports 60,000 crore rupees, about $8 billion worth of medical devices. I partly agree and partly disagree with what Dr. Kang said. We are already achieving success. My own company provided 1 of every 7 syringes used globally for COVID vaccination. We're the top 3 manufacturers for syringes worldwide. In auto-disable syringes, my company is the largest manufacturer worldwide. So we only need to have a can-do attitude. India, including my company, are the largest manufacturers. I'll give you examples. X-ray machine, ventilators, PPE kits, masks, shunts, gloves, surgical gloves, not examination gloves, IV cannulas, surgical blades, and I can keep on. We have the largest market in the world, and people think we are only making consumables and disposables, not high-tech products. I disagree on that. We make linear accelerators, we make MRIs, we make CT scan machines. So it's not that we cannot do. We can do, provided the ecosystem is there to keep on motivating the manufacturer to keep on going forward and reinvesting. Globally, we're able to get value added. So most of us, people who have succeeded, have been focusing on the global market. We get better remuneration, better pricing internationally than we get in our own country.
Sure.
Thank you.
Thank you. Great. I think we may have time perhaps for one question. So if you could keep it crisp and make it a question. And if you want to direct it to somebody specific, please feel free.
Yeah. This question, I'm specifically addressing it to Sarah. I'll take a cue from Prabir and Dr. Reddy here. India for India, India for the global. Can you shed some light on Project Orbis? Orbis is the US Center of Excellence for Oncology Products, where US has started in 2019 and 7 countries have adopted it. India is not part of it. Where are we today? I know there are some discussions going on I'm part of the industry, so I'm asking you two late questions. Where are we today? What is for the future, or today and tomorrow? The reason I'm saying is with the tech, AI, and so many panels today and yesterday, you were missed yesterday for some of these relevant questions, maybe more. With this, a country can approve, and the same product can be evaluated or used. They don't have to go through the same regulatory process everywhere else. I would love to hear from you, Sarah. Thank you.
Yeah, thank you for that. And for those who are unaware, Project Orbis is something that's happening with our Oncology Center for Excellence. And it's really taking like-minded regulators who have confidentiality commitments with each other, sharing information that allows for faster approvals for multiple markets. So I think this kind of points back to some of the points that I made earlier about international consensus-based standards. When everybody is operating off the same expectations, regulatory-wise and quality-wise, then it's easier to share information, it's easier to take similar decisions. So we don't currently share a confidentiality commitment with the government of India with regards to medical products. So I think that's an area maybe that will develop in the future, but I think that we would advocate for the adoption of international consensus-based standards. And when that happens, we actually have examples also in generic drugs. There's a generic drug cluster. When everybody's like-minded, decisions can be made in parallel. And so that's really one of the benefits of having international standards.
Okay, thank you very much. I'm sorry we have a distinguished group of people following us, so we've got to clear the stage. But let me just thank you all very much for your participation, and apologies to you guys not giving you more room for questions. But I think they will still be here, so we can collar them off the stage. Thank you.
We'd like to thank our esteemed speakers for sharing their thoughts on this session. I'd like to request Mr. Ramesh Subramanian to please felicitate the panelists. Can we please have a huge round of applause for them? I'd request Nicola to please felicitate Mr. Ramesh. We request you all to please be seated for the valedictory ceremony, which will begin shortly. Hello.
Hello. Request everybody to be seated. The valedictory ceremony will start at 4 o'clock. Thank you. Request everybody's attention, please. The valedictory ceremony will start at 4 o'clock. Request everybody to be seated by then. Thank you.
Check. Test. Check. Check. Check.
हाँ क्यों
Good evening, ladies and gentlemen. May I request all of you to please be seated as we welcome the chief guest for the valedictory ceremony. I welcome on stage Her Excellency the Honorable Governor of Telangana, Dr. Tamilisai Soundararajan, Honorable Minister for IT Industries and Commerce, Government of Telangana, Shri D. Sridhar Babu Garu, Honorable Special Chief Secretary, IT Industries and Commerce, Government of Telangana, Shri Jayesh Ranjan Ji, Shri B.P. Acharya, IAS, Retired Special Chief Secretary, Government of Telangana and Patron FABA, Mr. Jitendra Kumar, Managing Director, BIRAC. Let's give a round of applause for all our dignitaries on the stage. Thank you. Ladies and gentlemen, before we commence with the program, may I kindly request all the delegates to please rise for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you. Her Excellency the Honorable Governor Madam, Honorable Minister Sir, respected dignitaries on the dais, our most valued invited guests and delegates. My name is Paridhi Gupta and I lead the medical devices efforts for the Telangana life sciences sector. And it's with great pleasure but with a touch of bittersweet sentiment that we gather here today to mark the conclusion of what has been an extraordinary journey of the 21st edition of BioAsia. Over the past few days, we have had the privilege of coming together as a global community to explore the latest advancements, share insights, network, and foster collaborations in this dynamic field of life sciences and healthcare. Cutting straight to the chase, as the first segment of the ceremony, we are thrilled to announce and invite the top 5 startups meticulously selected by our esteemed jury of experts from a diverse pool of over 70 startups showcased in the exhibition. While we'll be honoring and presenting awards to the startups a bit later in the ceremony, we would like to now give an opportunity to them to come and talk about their innovation. And with this, we announce our first startup who won the award. I invite Mr. Jagmohan Reddy from ADV Therapeutics.
Thank you very much. And I'm indeed a great pleasure to have this award being in front of our Honorable Governor, Dr. Tamilisai Soundararajan Garu, Dr. Jitendra Nayak Garu, and Minister Garu, Sridhar Babu Garu. Thank you very much for this honor. BIOASIA, thank you IKP for all the support that you have been giving us over the years. Aspire Bionest for having us incubated here and the entire team here. We are a startup company that is developing peptide-based solutions for tissue engineering. We develop the artificial cornea. We are one of the only companies that can regenerate the entire cornea 3 layers using your own stem cells in your body. So it's a cell-free therapy.
that will be available over the few years. Thank you very much.
Congratulations, Mr. Reddy. The next startup is Z-Blocks Logitech. I invite Mr. Rao Kotupolu to come on the stage.
Hello everybody, my name is Rao Kurupolu. I am co-founder and CEO of Z-Blocks. It is a great honor to receive this award in such a big platform as BioAsia. We are a 5-year-old startup. We started our journey in the conferences about 3 years ago in BioAsia. This is the 3rd year. We continue to come here and we have great belief in this platform. We have made many interactions and created great alliances. Our product solves the cold chain problems in healthcare. We have a patented Actipod, which is an innovative carrier, uses battery power to maintain the right temperature for donated organs, blood products, research samples, and any such temperature sensitive products such as vaccines and so on. We're indeed honored to receive this award in front of all these dignitaries on the podium. Thank you so much.
Congratulations. The next startup is Design AI. I request Mr. Vishal Gupta to please come on the stage. I also request the rest of the startups to assemble on the left-hand side of the stage, please. Thank you.
Hi, I'm Vishal. I'm the co-founder and CEO of Design AI. Thank you, BioAsia, for this wonderful recognition. So we're building a platform for scientists so that they can enjoy R&D again. And the journey started around 8 years ago when we realized that in fact, less than 10% of research being published is reproducible. So we went ahead, built out a platform, took inspiration from a lot of different domains, especially software engineering, and invented a platform which now helps automate documentation, so it frees up time for scientists to be creative again. Also, I would like to thank a lot of other people. It takes a village to raise a child, and especially for a startup, it takes an ecosystem. So I would like to thank CIE who've supported us, IKP, AIC, CCMB, and a lot of other people, BIRAC in fact, for giving out grants. We've not won any, but hopefully we'll get something in the future to help us and reach this far. Thanks a lot.
Congratulations, Vishal. The 4th startup is Lemark Biotech. I invite Mr. Vaibhav Bhatia on the stage, please.
Hello, everybody. Again, thanks to everybody here who have given an opportunity to speak in front of such a distinguished set of listeners and people who have been in the field of healthcare also. I'm Vaibhav Bhatia, and I would like all of you to imagine if all these vaccines, all these life-saving medicines could be transported, could be stored at room temperature, and this could enable their access in the deepest pockets of the globe. And this is exactly what Lemark is doing. We are a group of scientists, business people, people coming from pharma background who are developing formulations of these life-saving medicines which could be stored and transported at room temperature independent of cold chain. Our flagship product is a thermostable insulin which has been supported by BIRAC, by National Biopharma Mission. We are really thankful for their support. We have reached the stage at where we are today. And we hope that in future we would be developing other medicines in other biologies like retinopathies, cancer, vaccines, especially veterinary vaccines. I'm really thankful again to all of you. and looking forward to your support. Thank you.
Congratulations, Vaibhav. And our final startup is Plebic Innovations. Dr. Krishna Prasad, please come on the stage.
Hello, I'm Vivek, co-founder of Plebs Innovations. Our founder, Dr. Krishna Prasad, could not attend. So thank you, BioAsia, for this opportunity and Telangana government for this wonderful stage. So our mission is to make ultrasound accessible to the last citizen of the country. So no one should be deprived of access to ultrasonography. So majorly the rural population, the pregnant woman, and any early stage tumors or cancers can be detected easily with ultrasound. And 66% of the Indian population doesn't have access to that, which is the basic diagnostic test. So in the process of solving this need, we have developed a robotic system within India. Like almost 90% of the design and fabrication is within India. Only few components are being imported, and we have developed a wonderful robot, which is 6-DOF robot, which is low cost. The BOM cost would come around 3 lakhs. If you look at any robot in the market, even if we import from China, it's around 10 lakhs. So now we have, after making this robot, now we could see several use cases, the tele use cases, which can be deployed at the PHC levels as well. So now we are a 2-year-old startup and we are at MVP stage. We have developed the robotic system, and now we are going into the clinical stage. And we were initially bootstrapped and we have designed and did everything. By the time we lost our funds and we have no way to go, like then government started helping us. Like we have received grants from AICCCMB, BIRAC under GenCare grant, and IKP for supporting us, and IIT Hyderabad. So the ecosystem is supporting us for a small startup to grow and to sustain. Thank you very much for the opportunity. Thank you.
Congratulations to all the 5 startups. We would now like to acknowledge the support of the Department of Biotechnology's BIRAC for supporting the BioAsia startup stage and also for playing crucial role in fostering the growth of startups, particularly in the biotechnology and life sciences sector. I invite Dr. Jitendra Kumar, Managing Director of BIRAC, to address the audience.
Honorable Governor of Telangana, Dr. Tamili Sai Soundararajan, Honorable Minister of Industries and Commerce, Sri Sridhar Babu, Mr. Jayesh Ranjan, IAS, Special Secretary of Industries and Commerce and IT, Mr. BP Acharya, IAS, Special Secretary, Retired Government of Telangana. I am very glad to be here today on the occasion of valedictory function of 21st edition of BioAsia. Actually, these are the occasions which put our country into the global map. These conferences, this BioAsia has created its mark over the last 20 years by creating its brand value, and the startups, industries, academia, all these stakeholders that get an opportunity, those who get an opportunity to interact and collaborate, has put our country on the global map. Similar is the case with other conferences, Global Bio India that BIRAC organizes, then we have in Bangalore. So as a nation, these are proud moments for us. These are celebrations for us. I really congratulate all the 5 startups who have won this award today. In fact, all these startups have been either funded through BIRAC or indirectly through BIRAC supported clusters. For example, IKP Knowledge Park, or AIC, CCMB, or BioNest. So this is the occasion that we should celebrate the kind of ecosystem we have built and there is a long way to go. All the more because one of the greatest challenges that our country faces in terms of therapeutics is to bring the cost down. And I think when all these minds and stakeholders come together, they devise the ways in which the cost of therapies can be put down. These 5 startups are just the tip of the iceberg. There are so many startups who are doing wonderful work. And when I say the costs have to be kept down, I think these startups are contributing to it by innovations. Because if the IPs are generated in our country, which has not been the case so far in terms of the innovations in bringing the cost down, IP is a major component which can bring the cost down. And of course, consumables that if we can manufacture in our country, biomanufacturing if we can do in our country, I think these all will bring the cost down. In today's event, the theme is AI, data, and how it can transform the therapeutics. I think many of these startup companies are using AI and data-driven sciences to bring the innovations together. So I really thank Government of Telangana to have invited me here, and I really think that these 3 days of conference and interactions have paved the way for many more collaborations and MOUs that have been signed. So with these words, thank you so much. I wish you all the best for the next year's edition. Thank you.
Thank you, Dr. Kumar. May I now invite Shri Jayesh Ranjan, IAS, Special Chief Secretary, Industries and Commerce and IT Department, Government of Telangana, to address the audience. Over to you, sir.
Thank you very much. Her Excellency, the Governor of Telangana, Honorable Minister for Industries and IT, respected Shri B.P. Acharya, Dr. Jitendra Kumar, members in the audience, delegates, most importantly, all the startups who participated in the startup showcase, and 5 of them who are receiving awards today. As I look back over the last 2 days, this has indeed been a very, very exciting BioAsia. I've been attending this event for the last 10 years, 2 years virtually and 8 years in person. But the quality of speakers, the quality of delegates, the kind of panel discussions, the kind of sessions that we had this year, I don't recall getting so much of brilliance over 2 days any time before. So I feel very happy about it, and also very happy that we were able to inaugurate this morning through our Honorable Minister, the World Economic Forum's Center for Fourth Industrial Revolution, which will focus on some very unique opportunities that life sciences and healthcare is providing today. And Hyderabad and the Telangana government will be able to have this kind of achievement against its name. I am also very happy to share with you that many of you would be aware that in the last many years, large number of life sciences companies are selecting Hyderabad to set up their GCCs, their capability centers, their technology development centers. For few other verticals, we have been able to create a community of such industries. For example, Hyderabad is a very important destination for the banking, financial services, and insurance sector, what is called BFSI. And we have a BFSI consortium, which represents 60 plus banking, financial services, and insurance companies. Hyderabad is also a very important center for the animation, gaming, VFX, multimedia sector. They have their own association called TWAGA. IT services companies have their own association called HICIA. But in this BioAsia, during this BioAsia, we have been able to come to an agreement with the industry that they will come up with a life sciences GCC consortium also. And the fact that such a consortium exists or will come into existence will also help us in designing skilling programs, in creating infrastructure, in connecting startups with larger companies, and various other things which are of priority to both the industry and for the government. So this also has become a very useful platform to achieve something of this kind. I'm happy that today's session, the valedictory session, is dedicated to startups, because this is one area where we are seeing amazing amount of disruption. Even the 5 startups who presented their ideas, I can see the amount of foresight which they are bringing in their solutions, and I'm very confident that each of them will be able to find more and more market opportunities to bring their solution into commercial value. As a government, we would always be committed to supporting innovation, entrepreneurship, startups. We would encourage even those who are not located in Hyderabad, because this startup competition was open for startups from anywhere in the country. While some of you could be from Hyderabad, many of you could be from other places as well. And my suggestion would be that given the supportive ecosystem that we provide here in Telangana, if you want to scale up and go far, it won't be an impractical suggestion to advise you to shift your office and your team and your location to Hyderabad and benefit from all the support, all the new progressive policies that we offer. So it is with tremendous satisfaction on one hand, and also a sense of sadness that months of preparation, counting down the days when this event will actually start, we have come to an end where we will be kind of saying our goodbyes. But hopefully we will come back next year with an even bigger, better and brighter edition of the 22nd BioAsia. Till then also there will be lots of opportunities for us to stay connected, to interact regularly, and I look forward to being in touch with all of you. Thank you all the sponsors, all the organizers, the entire team which has made the 21st edition of BioAsia a very big success. Thank you very much.
Thank you so much, sir. May I now invite Shri B.P. Acharya, IAS retired Special Chief Secretary, Government of Telangana and Patron Faba to address the audience.
Honorable Governor, Honorable Minister for IT and Industries, Mr. Jayesh Ranjan, Special CS Industries, Dr. Jitendra Sharma, distinguished delegates, ladies and gentlemen. It's indeed a very proud moment for us, and if I may say, it's also a very nostalgic moment. 20 years ago, when we started BioAsia in a forum like this, February 2004, I happened to be the Secretary Industries then. We didn't realize that it's going to grow so big. Let me jog my memory with your permission, ma'am. Over this last eventful 20 years, how the event has grown, how this conference has grown, and along with the Genome Valley also has grown by leaps and bounds. In fact, the idea of having a conference like this was to showcase Genome Valley as the biotech hub of India. It had just begun then, 2001, and we thought we should have an event to showcase as an ecosystem which should attract industries from all over the world, if not India. It was a difficult task to begin with, but Hyderabad presented a very unique combination of the partnership. We have all heard of the PPP, the public-private partnership, but here it was a very different kind of a partnership between academia, industry, and the government helping it. We had an advisory committee which was headed by the retired director of CCMB. The academia came in support to us, and they told us these are the things you should do in the government. The industry also was fully involved. That's how this ecosystem succeeded, and others did not. Many other cities, many other states tried, but they haven't been as successful as Genome Valley has been. Many other events were started, but they didn't sustain like BioAsia has done. So I would like to take this opportunity to compliment the team which carried on the efforts in the last 20 years. When we started it, and I was involved in some ways till about last 10 years, After that, it was Shakti and his team which carried it forward, and it has truly become the magnet for attracting talent from all over the world. What made it happen, in a way, goes to its predictability. Every year in the month of February, this event people look forward to. Initially, we started it in the first or second week of February. Soon we realized that it's going to clash with the Chinese New Year. So you won't have the delegates coming from Singapore, China, Korea. This again being called BioAsia has a story to it. We wanted this to be a platform to showcase what is happening in the Asian countries, the Pan-Pacific countries. Till then, we had the the annual event which happens in the US, which was showcasing the achievements in USA and Europe, as if nothing was happening in Asia, which is a fact in a way that nothing much significant was happening in Asia then, but we wanted to have a platform to have networking among the Asian countries to showcase this. That is how this name BioAsia was coined, and the event has grown over the years. We also made it a point to recognize world-class talent by conferring the Genome Valley Excellence Award. Many Nobel laureates were given. Some people who got the award got the Nobel Prize after that. Martin Evans is a case in point, the stem cell researcher who was given the award, and next year he got the Nobel Prize. So the predictability, the quality, which what mattered and kept sustaining this event. So I wish that this event grows along with Genome Valley. Genome Valley by itself is an interesting ecosystem which was not easy to build. It has taken years. Unlike the other IT clusters where you build a building and it grows on its own, it is not like that. We have friends from the pharma and the life sciences industry where they need every element of that cluster has to be very carefully planned, meticulously planned. That's how it has been a kind of a labor of love for me over the last 20 years to be involved in Genome Valley. And it is today what it is. No, very few cities in India and perhaps in the world can boast of an ecosystem as vibrant as Genome has come to grow to other sectors of biotech industry like ag biotech. Dr. Sharma is here. I was requesting him to have the ag biotech foundry, biofoundry, which is sanctioned by Government of India. He must help us to have it in Genome Valley, in the new phase 3 of Genome Valley, which will be the point for upscaling technology of the ag biotech companies. There are so many seed companies, so many biopesticide companies which can be helped with that. There is animal biotechnology, which is the new area. We have the National Institute of Animal Biotechnology. So this is the new frontiers of technology apart from biopharma and life sciences and healthcare, where the biotechnology can grow. There is a fund created by the Government of India, R&D fund, with an outlay of over 10,000 crores. So I hope the biotechnology gets its share, and part of that money we can have R&D clusters in the Genome Valley also. In fact, it was the first ever R&D center in India. The R&D in Knowledge Park, which was built in the Genome Valley, was the first one. So keeping that in mind, I would request Dr. Sharma to help us in building these kind of clusters. Once again, take this opportunity for complementing it. The Federation of Asian Biotech Associations, FABA as it was called, was the original organizer which was thought of hosting this event. They played its part by ensuring that chapters of FABA, they were present, and it continued over the years. They were also helping the biotechnology, the BioAsia to grow. Thank you very much, and all the very best for the next 20 years to the Sakti and his team and the entire biotechnology BioAsia team. Thank you for the opportunity.
Thank you so much, sir. Now, with heartfelt gratitude for his invaluable support and encouragement, I am honored to invite the Honorable Minister of Industries and Commerce, Shri D. Sridhar Babu Garu, to address our audience.
Very good evening to all. Her Excellency, Honorable Governor Tamil Sai Soundarajan, our Principal Secretary Jayesh Ranjan, the man who started this BioAsia 20 years back, Mr. B.P. Acharya, Sri Jitendra Sharma ji, and all the other contributors for the BioAsia here, the scientists, the entrepreneurs, the industrialists, and especially the active and cooperative government officials who have been doing a great show in conducting the past 20 editions of BioAsia very successfully and building a very dynamic and vibrant ecosystem. Thanks to everybody, including the Shakti and his team. You know, first of all, I would like to congratulate the winners, the award winners of the startups for their innovative solutions for the healthcare. And also I see many igniting minds sitting over here who would be the possible and potential Nobel laureates or the fast expanding business entrepreneurs of tomorrow's global world. So as we've seen for the past 2 days, as we are drawing the curtains on the 21st editions of the BioAsia 2024, we reflect on the incredible journey we embarked upon together. This is the first time BioAsia has taken the whole HICC, and the event is outsizing the largest venue of the city now, with the various activities spreading out. 2,000 plus delegates have visited this park. This time, over the past 2 days, we have seen the largest participation with more than 200 exhibitors and startups showcasing their innovations. About 2,737 delegates with over 750 visitors exploring the latest advancement and forging new partnerships. 80 odd speakers shared their insights of knowledge. This BioAsia conference has facilitated over 2,800 B2B, business to business meetings here. More than 4 Fortune 500 CEOs attended for the first time in history. Takeda announced, I am proud to say, a multinational company, Takeda, announced 50 million doses of dengue vaccine manufacturing in Telangana in collaboration with Biologically. I would like to also mention here the German company Milteni announced setting up their first R&D center in Telangana. I am more happy to say that about 2,000 crore investment has come from Oryx Propellant and Terminus Group. 2 days back, we had an opportunity to inaugurate the largest corporate pharma BMS and also a Providence office center. We had also had several specialized events on the sidelines. Western Australia Roundtable, Queensland Roundtable, Flow Chemistry Roundtable, Cell and Gene Therapy Symposium. So after several years, the event was graced by the presence of Honorable Her Excellency Governor, Honorable CM, and Honorable Deputy CM. And we take pride in sharing the information. Today in the morning, we inaugurated C4IR Telangana and was launched today along with the collaboration with World Economic Forum. It is the first ever thematic center focused on healthcare and life sciences. So this is the biggest contribution of the BioAsia and the scientists and the entrepreneurs, and especially the science family. Partnership with the Digital Medical Society from USA, Calix from UK, National University of Singapore, and German Healthcare were announced today. In conclusion, overall numbers reflect the growing importance of BioAsia on the global stage and the immense potential of healthcare industry in Telangana. As we leave the event, let us carry forward the spirit of collaboration and innovation, knowing that together we can overcome any challenge and create a healthier, more sustainable future and the best healthcare for our global citizens. And I thank all the organizers of the BioAsia who had put in their labor, their energy, their time to make it success. Thank you one and all.
Thank you so much, sir. We are now delighted to proceed with the felicitation of our top 5 startups. I request the esteemed dignitaries on the dais and all the 5 startup founders to join us on the stage to accept their awards. Mr. Jagmohan Reddy, Mr. Rao Kotupulu, Mr. Vishal Gupta, Mr. Vaibhav Bhatia, and Dr. Krishna Prasad. Please come on the stage. While the startups are being felicitated, I would also like to acknowledge the jury members for their support. Ms. Shilpi Kochar from BIRAC, Dr. Madhusudan Rao from CCMB, Mr. Mahesh Iyer from Pfizer, Dr. Vishwanathan Dupatla from IKP, Mr. Ranajit Sen from Graphene Med Resource, and Dr. Newton from the Consulate General of Netherlands. Thank you to the jury for their support as well. Let's give a round of applause to the startups. Congratulations again to all the startups. It is with great honor that I now extend our invitation to Her Excellency, the Honorable Governor of Telangana, Dr. Tamilisai Soundarajan, to address the audience.
A special good evening to each and everyone here. My respects to Sridhar Babu Garu, Minister of Industries and Commerce, the Government of Telangana, Sri BP Acharya, IAS Special Chief Secretary, Retired, Government of Telangana, Mr. J.S. Ranjan, IAS Principal Secretary of the Industries and Commerce and Information and Technology, the Government of Telangana, Mr. Jitendra Kumar, Mr. Shakti Nagappan, the Director, Life Sciences and Pharma, Government of Telangana, distinguished guests, esteemed media friends, all the dignitaries, the researchers, the scientists, the startup entrepreneurs, ladies and gentlemen. I am honored to participate as the chief guest of the 21st edition of BioAsia. The Global BioAsia Forum, it is with a deep sense of gratitude and accomplishment that I address you today at this prestigious event. When I was talking with Sri BP Acharya Garu, he was telling before 20 years, he had the mind to start and he was motivated to start about this BioAsia, and it is almost 20 years old, 20 or 21 years old. It has crossed its teens. So now it is more mature to support more entrepreneurs. And I am standing before you not only as a governor, but as a doctor who always feel whatever may be the invention and whatever may be the advancement, it should be useful to the poorest of the poor. It should be useful to the rural population. And when I was hearing about the startups, whether it is about cornea on cornea or artificial intelligence, particularly cold chain, and I was very happy to know about the ultrasound. Because I am an ultrasoundologist, practicing ultrasound till I became the president of a political party. And I know the problems faced by the rural population for getting this ultrasound done. I have faced so many painful situations when I saw the patients who did not have the basic ultrasound scanning in their first trimester, landed up with very complicated anomalies. For example, during the last trimester, I scanned a patient, a young preemie, who the baby was with hydrocephalus, big head with full of fluid. An early ultrasound could have diagnosed this. And this patient, she was a very young lady, and because of the big head, we were forced to do a cesarean instead of a normal delivery for almost a non-viable baby. So when I asked why you didn't do the ultrasound, two things she told. One thing, my mother-in-law did not allow me to go for scanning. Why means we were unable to afford the money to be paid. We were unable to afford to come to an urban center for this ultrasound scanning. And I'm very much happy and excited when I knew about this ultrasound, this startup, robotic, so that it could be used because of the cost. Because in a developing country like India, the cost is very important. In a lighter sense, I used to say, when I was practicing, one patient came and told, I suspected something, and we did a investigation for almost spending 3,000 to 4,000 rupees. That person came and sat in front of me and told, Doctor, don't tell that I'm not having anything. At least tell something I'm suffering from. At least diagnose something. Then I told, it's surprising for me. A patient will always say, I should be hale and healthy. I should not find anything in the investigations. But you are telling, at least tell something. Then he told, my wife will scold me if you tell nothing is there. For this only you spend 4,000 rupees, which I am suffering because it's a great budget for me. So always the cost is a matter of concern to the people, particularly rural people. When I heard that this ultrasound, which may be cheaper and it could be practiced even in the rural areas, really I appreciate, and I appreciate BioAsia by creating a platform, such innovations. And as a doctor, I really laud your efforts on that. So first of all, a great appreciation for BioAsia for making it possible. And like that cold chain also. Because when we practice in the rural areas, even though we think that it is effective, cold chain has been maintained. To our conscious, sometimes we are unaware really the cold chain is maintained or not. It should be effective to the patient. But when such inventions are there, really we are very confident that we are giving the potent vaccine to the patients. And as it is said by our Honorable Minister, we are very happy. As a doctor, very proudly I can say, during the COVID situation, I have taken the Indian vaccine, particularly produced in our state, Bharat Biotech. And why I am telling that, when we were medical students, we were longing for a situation like that. The polio vaccine came to India after quite a long time. Rubella vaccine came to India after quite a long time. But when we produce vaccine and when we not only produce the vaccine, not only given to our people, when it was exported, a person like me, really, we felt very happy, so that particularly the participation of the entrepreneurs, the biotechnology centers, and in the pharma hubs from Hyderabad, I am really very happy as the first citizen of this state. And I am not a technological person, but after this invention of the artificial intelligence, we can say, the breast cancer, 20 times it is more diagnosed than before. When artificial intelligence, when the technology is incorporated with the mammogram, I have to say 20 times more it is diagnosed. Even the most earlier stages are diagnosed. So this is what we want. Because whatever may be our intelligence, whatever may be our talents, we should have a basic health to achieve greater things. Particularly when incidence of cancer are more, the early diagnosis is much better because more treatment facilities are there for early detection of cancer. So artificial intelligence really helps us. As a gynecologist, I can say in fetal therapy also, because I practiced fetal therapy and I practiced ultrasonology, and I always feel whatever may be the technology, it should be useful to the poor people. It should be useful to the rural population, because making them understand about the technology is very, very difficult. In a lighter sense, I always say, once I was practicing ultrasound, when we asked them to come for ultrasound, they used to say, it is a mission to diagnose whether it is a female or male. That is the knowledge they had. And when I asked the patient to come with full bladder, because we have to study because I wanted to study the prostate, I wanted the patient to come with full bladder. He's a village person, a farmer. I told him to come with full urine. Next day he came and opened an yellow bag and put one bottle of Horlicks bottle in front of me and another Horlicks bottle in front of me. What is this, I asked? This is full urine. You only asked me to come with full urine. So it is not their mistake, because the awareness we have to create among them. We all know about machines. We all know about diagnosis. But they are the people. They are focused to their work. They don't know. But we are the people who have to make them aware of the situation. So I'm really very happy when I knew about the startups. And I knew about the BioAsia and the government, Telangana government supporting the BioAsia and the entrepreneurs. I really appreciate them. And I, as the first citizen of Telangana, I really happy that I have participated in this program. And the technology may be different, but finally the diagnosis and finally the usefulness of this diagnosis to the rural population and the poor is my concern. And I'm really very, in future also, whether it is cornea, whether it is all the other diseases nowadays, renal diseases or more. My husband is a nephrologist. I always say, because my husband is a nephrologist, and once one of the person asked him, when I became the governor, he interviewed my husband and interviewed me. Then he asked, what is the happiest moment in your life? Is you became a governor, or your wedding anniversary day, or your birthday? Then I told, for my husband, seeing the first drop of urine from the transplanted kidney is the happiest moment than any other thing. So the rural population, renal disease are more. Now the solution is only transplant, but when the diagnostic tools like ultrasound, when it reaches the rural population, it could be diagnosed at the earlier stage so that the problem reaching till the transplant can be prevented and the early diagnosis so that the kidneys may be saved. Because in a country like us, developing country, the diagnosis, early diagnosis and prevention carries more value than the treatments. So I am really very happy to attend this program, and I appreciate the BioAsia and the organizers for supporting the entrepreneurs and supporting the researchers, and I appreciate Minister Sridhar Babu Garu and all the Telangana government officials and all the researchers and the scientists and all the global participants, the dignitaries, who are delegates, who have come over here to support, and I'm really very happy to attend. I wish you all the best. I expect more innovations and inventions and innovations so that it will be useful to the common public, more and more useful for early diagnosis, more and more useful for early treatments, and more cheaper treatments and cost-effective treatments, and more useful to the poorest of poor. Thank you so much.
So much, ma'am, for gracing us today. I request the Honorable Minister of Industries and Commerce, Shri D. Sridhar Babu Garu, to kindly felicitate Her Excellency, the Honorable Governor of Telangana. A big round of applause for our dignitaries, please. Thank you. With this, I would like to extend our heartfelt gratitude and say quick thank yous to first our esteemed speakers and panelists. It was indeed a great honor for us to welcome and host in Hyderabad prominent CEOs and leaders known for their great contributions to life sciences sector. Thank you for the insightful discussions. I also want to express my deepest appreciation to the organizing committee, partners, volunteers, exhibitors and sponsors for making this conference a resounding success. Our sincere thanks to the media for giving an excellent coverage to the event, and we hope the buzz continues. To the delegates and attendees, thank you for your active participation and engagement throughout the conference. We hope you had a productive time and that you are going back with a lot of business connections to be pursued. Thank you once again all for your participation, and we wish to see you all in the next edition. Thank you and good evening.
learned about the innovations.
Well done again. ये थोड़ा arrangement अच्छा नहीं लगा मुझे.